Welcome all to our April 9th Board of County Commissioners special meeting. If we could all stand for a moment of silence and remain standing for the pledge. Pledge allegiance to the flag
of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Okay, we're going to have our updates first, and then we're going to take public comment. We have a 9:30 preset with the BDB with a presentation on the PPP. Can you hear me? Yeah, I'm working on that. And
Move to approve the agenda.
Second.
okay, we have a motion and a second to approve the agenda. All in favor?
Aye.
All opposed? Motion carries unanimously. Okay, I believe we're going to start with Michelle Jones from Emergency Management and Chief Schobel.
Yes, sir.
Will follow, I guess.
Good morning, Commissioners. We have provided you a handout that has the latest situation report, daily report, and communication statistics. Since our last update, we have also launched a new dashboard ITS has developed for us that has county-specific COVID-19 data, has the cumulative cases, age distribution, new cases by day, and that can be found at martin.fl.us/COVID-19 dashboard, which is also linked on our coronavirus webpage. Our Community Information Center continues to field calls. That phone number is 772-287-1652. It's open daily, 7 a.m. to 6 p.m., but it will be closed on Sunday, April 12th. They're currently fielding about 100 calls a day, and to date have fielded over 1,600 calls since opening on March 18th. Frequent questions that they're getting asked are about the boat ramps, parks, essential, non-essential businesses. And as a reminder to the public,
I'm sorry. Can you either
sorry.
speak a little bit into the mic, or it's just very hard to hear? I'm sorry.
Speak more slowly if it's possible.
I will try. I'm sorry. All right, is that better?
And can you speak with an accent?
Maybe on one leg?
Can you stand on one foot?
Talented, but not that talented. All right, so I apologize. Good morning. So we have provided each of you with a handout that has the latest situation report, the daily report, and our communication statistics. We have also launched a new dashboard, a COVID-19 dashboard that has county-specific data on cumulative cases, age distribution, new cases by day, and that can be found on our coronavirus webpage, and it can also be found at martin.fl.us/COVID-19 dashboard. Our ITS department developed that, and it updates automatically as the FDOH dashboard updates, but it doesn't require you to go in and find Martin County, so it's a nice snapshot of where we're at. The Community Information Center continues to field calls. That phone number is 772-287-1652. They're open daily from 7 a.m. to 6 p.m., but they will be closed on Sunday, April 12th. They are currently fielding about 100 calls a day, and to date have fielded over 1,600 calls since opening on March 18th, I apologize. Some of the frequent questions that they are getting asked are about boat ramps, parks, essential and non-essential businesses. So as a reminder to the public, Martin County-owned boat ramps will be open for recreational boating activities on weekdays and will close at 8 p.m. on Friday night and reopen 8 a.m. Monday morning, except to state-licensed commercial marine activities who may operate out of the boat ramps in Sandsburg Park and Jensen Beach. And the Florida Department of Environmental Protection has closed all state-owned uplands, beaches, islands, emergent shoals, and sandbars, including the sandbars located in the Intracoastal Waterway. And for those on the water, the Florida Fish and Wildlife Conservation Commission has directed that all recreational vessels shall have no more than 10 people on board and must maintain a 50-foot distance between each vessel. Reemployment applications, we discussed at the last meeting. Those have been provided to our nonprofits to share when providing food distribution or financial assistance. And those applications are also available at FedEx locations, and once completed can be dropped off at FedEx locations, who will ship them free of charge overnight to the Department of Economic Opportunity for processing. We're also creating a resource card with contact information for our local nonprofits, which can be shared at those food distribution or financial assistance sites for any individuals that might need continuing service assistance. And we continue to work closely with Cleveland Clinic and the Florida Department of Health to plan for a potential peak of this incident and how that may impact our healthcare system. We've worked with the Department of Health on a handout for those who are asked to self-isolate or quarantine with information on what to do when they are sick and where to go for additional help if needed. And we are continuing our regular communication efforts. Martin County update videos we're releasing every weekday with our star, Ms. Krista. Released 3 so far, and yesterday featured Taryn and our sheriff. Those are posted on MCTV starting at 4:30 p.m. each weekday and will be posted on social media, website, and then also emailed out. We are taking questions from the public for those to be addressed in those videos, and they can email those questions at covidquestions@martin.fl.us. And then Friday, featuring our chair, is a weekly wrap-up version. Our daily report is emailed out each night and posted on social media and the website. Our website maintains constantly updated throughout the day. We continue with our social media platforms, Facebook, Twitter, and YouTube, and our Alert Martin emergency notifications, which folks can register at 888 by texting Alert Martin to 888-777. Our community update emails are sent out weekly, and then we continue with our news releases and personal media contact. We are asking our community to continue to take this very seriously. Take this time to stay home, and if able, and connect virtually with family and friends. And next week is our Public Safety Telecommunicator Week. And earlier this week, you heard from Katya with the Sheriff's Office about the Herculean effort of our 911 dispatchers, our first responders, and our healthcare workers. And we thank them all for their efforts and look to celebrate and especially thank our public safety telecommunicators next week from Fire Rescue and the Sheriff's Office for all of their effort to keep our first responders safe. And with that, we ask our community to stay home, stay safe, stay connected, so that we can all stay together, Martin strong. Any questions for me? All right, thank you.
Thanks, Michelle. Chief?
You running out?
Can you hear me okay? Yes, sir. All right. Good morning. Bill Schobel, Fire Rescue Chief, Martin County Fire Rescue. I'm here to tell you all of our first responders in Martin County continue to respond without delay to normal 911 calls and also COVID-19 patients. We transport about 5 to 6 COVID suspected patients a day. That doesn't mean that they have COVID-19. It just means they meet the criterion on our screening tool of a high suspicion, and then we allow the testing. Cleveland Clinic, Martin Health will then make further determination once they get in there. It's relatively, like I said, we're responding without delay. I want to assure the community there are no issues. The state we just received another shipment yesterday with PPE, so we have ample personal protective equipment to do our jobs. And also a shout out to our 911 dispatchers. Obviously, it's their week, and we're kind of shut down, so it's a little bit bittersweet here. But I definitely want to give a shout out to them. They do an awesome job. We've taken extra precautions to protect them, as you've heard throughout this week, and they're safe. They're doing their jobs, and thank you for everything they do. Any questions?
Nope. Thank you, sir.
Thank you.
Okay, now we're going to get an update from the Department of Health, Carol Wagner-Vitani. you're going to have to point it down a bit. So, yeah. There we go.
Good morning, Commissioners. Thank you for allowing me the opportunity to give you an update on our COVID-19 situation here in our community. We are grateful for your support as we work in partnership to take all available and necessary actions to stop the spread of this virus in our community. Sadly, the Florida Department of Health is reporting its first death from COVID-19 in Martin County. Our deepest sympathy, condolences go out to his loved ones and friends. As of last evening, there are 108 confirmed cases of COVID-19 in Martin County, 105 residents and 3 non-residents. The health department staff continues contact tracing 7 days a week of all the positive individuals. This is critical to decreasing the spread of the virus. Health department staff is in daily contact with our long-term care facilities, urgent cares, dialysis centers, and rehabilitation facilities. We continue to work with our emergency management, the hospital, to discuss and plan hospital surge, as well as for alternative care sites. We realize that this situation is difficult and stressful, but it is essential that everyone take action to protect themselves and prevent the spread of the virus, which includes good hand washing, staying at home when you're sick, frequent cleaning and disinfecting of high-touch surfaces, and social distancing. The positive impact of social distancing has been seen in other states as well as other countries, that social distancing measures have been effective and will dramatically alter the progression of the pandemic, allowing our communities to distribute resources more effectively and ultimately save lives. This will help prevent our healthcare system from becoming overwhelmed. So we must stay the course. We encourage everyone to follow the governor's Safer at Home directive, especially if you're over 65 or have a chronic health condition, such as compromised immune system, hypertension, diabetes, heart or lung disease. Face coverings. As you know, the CDC recently recommended wearing cloth face coverings in public settings where other social distancing measures are difficult to maintain, such as your grocery store, pharmacies, those types of settings, especially in areas of significant community-based transmission. Cloth face coverings should not be placed on young children under the age of 2. The cloth face covering recommended are not surgical masks or N95 respirators. Those are critical supplies that must continue to be reserved for our healthcare workers and medical first responders, as recommended by CDC. The Department of Health just launched a community action survey called Stronger Than C19. This short 2-minute online survey will help the department identify and predict COVID-19 trends in the state and reinforce prevention efforts. The survey and the DOH dashboard with case counts by county is available on floridahealthcovid19.gov. One last thing, if you are becoming sick, call your healthcare provider for evaluation and to rule out other illnesses and stay home. DOH call center, as you've heard before, the Department of Health in Martin County has established a local call center to answer questions. That number is 772-221-4000, option 9. That line is active Monday through Friday, 8 a.m. to 5 p.m., and then we also have an on-call service for the weekends that you will be able to speak with one of our staff. The Department of Health call center at the state level has a 24/7 to answer any questions, and that number is 1-866-779-6121. Residents can also email COVID-19 at flhealth.gov. And the last thing I'd like to say is I would also like to thank the many people in our community who are working above and beyond to respond to this virus. The medical staff, the first responders, and our public health staff at the Florida Department of Health in Martin County, especially during this week, National Public Health Week. We thank you all for your support as we work together as a community to stay healthy and to stop the spread of this virus. Thank you.
Thank you, Carol. Any questions? Yes, Commissioner Hurd.
Do you have enough tests?
Well, the testing, the bulk of the testing is being done at the hospital, and we have a small supply of testing capability at the Department of Health, and that's specifically earmarked for our long-term care facilities.
Okay. I know that testing in the past, and at present, is taking up to 2 weeks to get results back. And there's some speculation about the duration of the virus, that in hopefully most patients, it doesn't last that long. So what about the reliability of testing from the time that the person is tested and the time that they receive results? If the results take 14 days to get back, how reliable can we assume that the testing is, if the gap time between the swabbing and the test results is 2 weeks or more?
Well, the test results have been coming back a lot more frequently, much quicker now since we have more testing capability available in the community. And by the time, I know that some of the situation has been when someone has gotten their results 10 or 11 days later, they're almost past that incubation period or that time that the virus lasts, about 14 days.
Thanks.
Do you have any other questions? Oh, go ahead. Oh, I'm
I have
sorry.
a couple questions on testing. So are we still using the same criteria that we were using several weeks ago? When someone calls up, they have to meet that CDC criteria for testing, and can you describe what that is?
Yes, for the testing, yes. The testing at this is still following the CDC guidelines, and the priority one is hospitalized patients, healthcare facility workers with symptoms, then patients in long-term care facilities with symptoms, patients 65 years of age and older with symptoms, patients with underlying conditions with symptoms, first responders with symptoms, critical infrastructure workers with symptoms, individuals who do not meet any of the above categories with symptoms, that might be through their physician who's recommending it. Individuals with mild symptoms in communities experiencing a high number of COVID-19 hospitalizations.
And then I also understand just from people in the community that now, because some folks are getting confused, there is the swab test, and then there's a separate test that tests for antibodies. Can you describe a little bit about that?
So there's been a lot about the testing, yes. The Department of Health will only accept FDA-approved tests, and the swabbing is the one that is the approved one. So you can do a rapid test, which will give you a pretty good preliminary, but then we always recommend doing a follow-up.
Are you seeing, and I heard this just yesterday from somebody that had called to get tested, or a family member of that person, and said they were getting quoted upwards of $300 for a swab test. Is that something that primary care physicians or?
I'm not aware of that, but the testing should be covered by most insurances or free.
So if a person doesn't have insurance, then?
Should be free.
Okay, and then finally, you mentioned that Department of Health was doing that survey. When would we expect to see that they compile that survey into some data that maybe filter back down locally so we can, it would help us with some decision making?
I don't have a date for that, but I will definitely bring it up on my call today.
Okay,
and
great.
ask. And I'll
Thank
get
you.
back with you. Thank you.
Go ahead.
Yeah, to follow on the cost issue, can we get a determination from the state if that's sort of legal? I mean, is it all right for the private, I guess, people who are doing it privately to make money off of this, or?
I guess I can't really speak about that. I don't know, so I'll
No,
have to
but can you, on your call,
find
can you
out.
ask to see what the?
Certainly.
I find that
Yeah, I
hard to
mean-
imagine, actually, but, thanks.
Okay.
Okay. Any other questions? Thank you very much.
Thank
Appreciate it.
you.
Mr. Rob Lord from the Cleveland Clinic. You're going to have to tilt it back up, so. There you go.
Mr. Chairman, Commissioners, thank you so much for the opportunity to be here. It is a privilege. We continue to operate under our emergency operations plan. I have been on that plan since March the 13th. With regard to supplies, I get a lot of questions about that. We do have adequate supplies. That does not mean we have all that we're going to need through this event. And we have to be mindful of the fact that supplies are limited, as the world knows. As a result of that, we are trying to both protect our caregivers and be conservative in the use of those supplies. And we continue to follow CDC and WHO guidelines on PPE utilization. We're also wearing cloth masks in our facility, or that's optional with our colleagues at this time. Closely collaborating with our public health officials, with the health department and the county. We have a great partnership in this community. I think we are fortunate in that regard, and I thank the county and Carol and her team. We're working very well together. We are looking at a number of contingencies ourselves, expanding patient care areas within our hospitals in the event of a surge. Have a little bit of information on that we can share with you and with the community. Our surge capacity at North and South hospitals, we think, is somewhere in the vicinity of 350 to 450 beds we can add. Now, that's less than ideal, and staffing that is a challenge for us, but we can do that. And we have alternate care sites identified that could add an additional 250 beds if that became necessary. And we're assisting emergency management and the Department of Health as they plan their alternative site capabilities. With regard to drive-through testing, there's been some questions about, first of all, there is no charge for our testing. Okay, I want everybody to know that. I want everybody in the community to know that. I don't care if you don't have a dime. If you have symptoms come, we'll take care of it. In fact, we have waived co-pays and deductibles on doctor visits. Okay. We have gone to one location in Martin County at North Hospital because the volume simply did not support having two. We can open up again and have two if the volume picks up, but right now that's not the case. Again, for the public, they must first call a triage line. That number is 772-419-3360. If that patient meets criteria, and we are using the CDC criteria that were mentioned a minute ago, they'll get an appointment for the drive-through facility. As of yesterday, we had screened more than 10,000 people by phone on that line. We've tested 780 Martin County residents, and then an additional 300 persons through our Martin County-based drive-thrus. Through this process, the reason this is important, this protects the patient, this protects our caregivers, this protects the community. Patient can come up, sit in their car, have the sample taken, never get out of their car, never have to come in direct contact other than with the caregiver that's working with them at the window. So we think that's the best case alternative for everybody involved, and it reduces exposure. Test results. To Commissioner Hurd's questions, hopefully I'll be able to fill in some information. Now, my information may not mesh exactly with what Carol Ann presented because I'm talking about Martin County residents. I wanted to give a specific report here today for you with regard to that. We've tested a total of 1,016 residents. Of that, We have received 958 results now. So that is a completely different situation than we were in the last time I spoke with you. We have 68 pending. Essentially, we went from about 30% of our test results had been received the last time I spoke with you. We're now at 88%. So the commercial lab has turned it around, and we have some additional testing capabilities. So there's been considerable improvement in that. We continue to push and to do everything we can to get quick test results from the commercial lab. We have limited supplies of test kits for the, we can run the Cepheid test and the Abbott test locally now. But there are limited test kits there, so we're using those for the inpatients, the caregivers, for, in situations where there's urgency, and then we're still using the commercial lab. We're seeing about a 5-day turnaround time right now on those. So that's, again, a considerable improvement. Virtual health, that continues. That is the way to get your health care today. I hope some of that continues into the future after this is over. We have implemented processes for patients to contact their providers, and we are using FaceTime and other apps now to communicate with our patients. In-person visits are still available if necessary, but most likely we would try to set up a video visit with you today if you called and wanted to see your doctor. And again, that's to protect the patient as well as our caregivers. And I'll repeat, we're waiving copays and deductibles. We have, again, because there's still some confusion about this in the community, postponed all elective cases. No non-essential procedures are being performed. That does not, if you have an emergency, we will take care of you, but that conserves a lot of the personal protective equipment. It increases our capacity as well in our hospitals and minimizes exposure. For our caregivers, we have created a housing program. We're providing accommodations at no cost to caregivers who have cared for patients and have tested positive. And then something else, I think I'm very proud of our organization, and I want our partners, colleagues in law enforcement and in fire rescue to know this. We have established a regional philanthropic program to benefit first responders on the Treasure Coast who are the front line of this COVID war, along with our frontline caregivers. The Cleveland Clinic First Responder Hardship Program will provide financial support to first responders who are experiencing a financial hardship due to COVID and wish to request consideration. This program will also be available to our own caregivers. We have a parallel program, but we want to express our gratitude to our colleagues that are where there's only one Jersey in this battle. I also want to indicate, and Commissioner Smith and I spoke about this, I think, last week, overwhelmed by the outpouring of support for our organization. They have contributed supplies, cloth mats, food, other items. They've come out and cheered at Change a Shift. Put tears in my eyes. So we're all impacted by this situation. My message to the community would be, there's a lot of talk about flattening the curve. I want to suggest we should try to crush this curve. To do that, we need to double down on social distancing and limit as much as possible going to public places, including the grocery store and other essential businesses. And finally, I am extremely proud of our dedicated caregivers. They're doing everything they can, and we're doing our part to prepare for the surge that may come. The local churches have done so much. Large and small businesses are delivering food to our caregivers at the hospital to express their gratitude. I just want everybody in this community to know how very grateful I am for the support of our organization. It means so much to them. I'll be happy to answer any questions.
Yes, ma'am.
I just have an observation, and that is that we're so fortunate to live in Martin County, and we're so fortunate that our medical facilities are under your leadership. You've done a terrific job. I'm so grateful to hear that the testing turnaround times have decreased by 2/3. We're in so much better shape than any other county that I know of in Florida, and it's in large part due to the coordination between your Cleveland Clinic and the county and the health department and our residents. I think we need to keep understanding that social distancing and staying at home is really important. That's how we're going to kick this.
Yes, ma'am.
Thanks.
I could not agree more. And particularly with the comment about the cooperation locally is so key in this. And so thank you for that observation very much.
Commissioner Smith.
Yeah, Mr. Chair, thank you. I just want to share a little bit, too, is following Commissioner Hurd. I did talk to Rob last week, and, following our meeting last week, I had probably 4 or 5 calls that I had different people calling for different issues, and I want to echo Sarah's comments relative to our local folks. To the person that I talked to last week, all of them said that when Rob got up to the microphone and started speaking on behalf of Cleveland Clinic, they were assured that our relationship, that our coordination, that our hospital, and that our people that we recognize and understand as leaders in our community, how important that was to everybody. And so, Rob, thank you for being here and continuing to be here. It really means a lot to have that local face that people know and trust when we're speaking about such things, and it really makes a difference. So thank you very, very much for all you're doing personally.
Thank you so much. I appreciate your kind words.
Mr. Campy.
Mr. Lord, thank you very much. Can you do us a favor and explain the visitors policy? Some folks that are not coming to the hospital for COVID issues that might be coming to the emergency room or being admitted. Can you explain so people understand before they get to the hospital what your visitors policy is?
Yes, sir. At this time, we unfortunately found it necessary to strictly limit visitors. Generally, a patient is not allowed any visitors. Now, in labor and delivery, one person is allowed to accompany the expectant mother. And end-of-life issues, we work with the family to try and address that. But people need to understand that. I mean, this past week, there was a circumstance where I had a family member who required health care, and the young lady at the door told me, sir, you are not allowed to enter the building with this patient. It applies to everybody, and it's for the protection of the patients and our caregivers and the person who could be entering the building. This is a very difficult condition to deal with. We believe there are asymptomatic people walking around that have the illness. You just don't know who is and who is not. Now, we're also taking the temperature of everybody who enters the building. If you have a fever, you will not be allowed to enter the building. That is true of all of our caregivers every day as well, up to and including me. I walk through the front door every day, and they take my temperature. I wish this wasn't necessary. I know we all do, but it's the right thing to do for our patients and our caregivers and the community.
Thank you.
Thank you.
Thank you, sir. Any other questions? Thank you, sir.
Thank you, appreciate it.
And for our 9:30 preset, Ms. Joan Goodrich from the Business Development Board, and I see George coming also. Uh-oh.
Good morning, Commissioners, Administrators, in Martin County. I'm Joan Goodrich from your Business Development Board, and I thank you for allowing us to continue our economic briefing this morning with a focus on the Payroll Protection Program, which became available to our businesses from the CARES Act just late last week. Joining us this morning to provide some real-world insight into this program, as the front door for this program is through our banking and lending institutions, is Denny Hudson III, Chairman and CEO of Seacoast Bank, headquartered here in Martin County in the city of Stuart since the 1930s. At this time, I'm going to invite Denny up to continue our presentation.
Thank Thank you very much, and I'm glad to be here this morning to talk to everybody and to answer any questions you have. Today I'm here to talk about the government programs that are in the process of being rolled out to the business community across the United States. Specifically, I'm going to talk about the Paycheck Protection Program. But first I want to say a few words about our community. Seacoast Bank has been an integral part of Martin County's community for almost 100 years. The first 40 years of our life, we were actually the only bank in the county. In those days, we provided just about everything for the community in terms of the fuel that our businesses needed to grow and prosper. Today, while there are many other banks that we compete with locally, our customers have blessed us with a larger market share than any bank in Martin County. We employ 800 people across the state, and about half of those live and work right here in this region. So I believe, and I know the people of Seacoast believe, that we owe the community everything we can do to help our business community stand up on their feet through this very, very tough time that we all face. And our businesses are hurting. For many, their revenue or sales volume has collapsed to zero or near zero due to the effort underway to protect the public. This is, of course, unprecedented in our history. Many of our businesses, however, have undertaken very innovative steps to change the way they operate, to continue serving the community and maintain at least some of their sales and revenues, whether it be local restaurants that are running curbside pickup services or other large retailers that are doing some of the same thing. At Seacoast, we've had to radically change and alter the way we operate to serve our customers. Around 500 of our associates are now working from home. We have redeployed people out of other jobs to double our call center personnel. We have changed the way our branches operate so that we can continue serving the community while also protecting our employees. The largest change, however, has been to stand up an entirely new government program in a period of several days. Over the last 10 days, we have redeployed and trained up every person in our lending function into new roles. The redevelopment and retraining of lending related personnel touched over 150 associates, with much of that training happening over this past weekend. In addition, we mobilized all of our support people who have worked in shifts to stand up this program while we launched, which we launched late on Friday. We have deployed the full resources of Seacoast behind this program because our community needs us. Our small businesses need it so they can stand on their feet, as I said, and continue to serve us. The thousands of employed people in those businesses here in Martin County need it so they can keep food on the table. We do this because our mission has been, since 1928, when we were founded, to help people improve their lives and build stronger communities. Let me give you a few highlights of how the program works. And there are a lot of details. I'm happy to go offline with anybody that wants all the details, but just high level loan amounts are based on payroll cost, and you can receive up to 2.5 times your average monthly payroll cost with a total max of $10 million per loan. There is potential for loan forgiveness when the funds are used for specified expenses, including payroll, mortgage interest, rent, and utility payments. The interest rate on these loans will be 1%, with payments deferred for 6 months or more, and it'll be based on payments will be based on a 2-year term, no prepayment penalty. Fees for the program are going to be paid by the government and not by the borrower at the time loan forgiveness is applied for. In fact, the 1% interest will also be paid by the government at the time the loan is forgiven. The SBA is administering the program and requires a simple application process with much less in the way of documentation requirements that would be found in a typical SBA loan. The program is open until June 30, but of course can be extended. Loans are up to 100% forgivable by the federal government and are 100% guaranteed by the government. The banks have a responsibility to simply verify eligibility for the program and to verify the payroll information that you provide on which we base the loan amount. So who is eligible to participate in this? Small business concerns with fewer than 500 employees. This can be sole proprietors, independent contractors, and the self-employed, as long as income is less than $100,000 per year. Also includes nonprofit organizations, veterans organizations, and tribal concerns. Business concerns with more than one location are eligible, and affiliation rules are waived for franchises with fewer than 500 employees. This means if you're running a franchise operation that normally under the SBA would be called an affiliated organization to a much larger company, as long as your single location has less than 500 employees and you're in the hospitality business or the food service business, even though you're affiliated with a much larger company, you can actually, as a franchisee, receive this loan. Businesses must have been in operation on February 15th of this year. So what is included in average monthly payroll costs when you do the calculation to see what size of loan you can be available for? Payroll costs equal certainly salaries, wages, commissions, and other similar compensation. Payment of cash tips or equivalents. If you do not keep track of tips, the government will allow you as the borrower to estimate what you think that would be for your business. Payment for vacation time, parental or family leave, medical or sick leave. All of that is included, as well as payment for health care and retirement benefits and payment of payroll taxes. The calculations are simply to add up all of those parts of payroll, which is basically your entire payroll cost to your business, average it over the last 12 months. We're using the 12 months ended 12/31/2019. We're looking typically at each of your quarterly payroll tax statements so that we can confirm what your total payroll was. And we're multiplying that by 2.5 to come up with a loan amount. This loan also can include a refinance, if you will, of any previous loans you've received under the SBA Economic Injury Disaster Loan Program. This program has been available for a long time, over time, and any time there's a disaster area declared in a particular community, and all of Florida is right now, you can qualify for this loan. This program, though, the Paycheck Protection Program, is generally believed to kind of replace that loan program for most small businesses. Proceeds can be used for continuing to make your payroll payments, your group health care benefits, your sick time, medical leave, insurance premiums for medical insurance, employee salaries, commissions, payment of interest on any loans that you have outstanding prior to this date, rent and utilities, and the like. Seacoast Bank is a qualified SBA lender. We've had that privilege for many, many years. We started receiving the PPP loan applications for review beginning on April 3rd, last Friday. Prior to that date, however, we put together a checklist for our customers to use in assembling documents that could help them bring together the information we knew they were going to need to actually make these applications. Our associates began reaching out to our small business customers in the week prior to the launch of the program, and that was based on our reading of the legislation, and we went into work quite heavily with our internal folks to launch those checklists. Most, if not every bank in the United States will be participating in this program. Business owners should start by contacting the bank where they hold their primary operating account for their business to find out the specific requirements needed to apply for this program. So how are we doing? And I would say one thing most banks are focused first on serving their existing customers, and I'll get a little more on that in a minute. So how are we doing over at Seacoast? Well, as of last night, we had accepted well over 1,000 applications, or around 250 per day, for funding totaling a little under $300 million. Around 20% of those applications have been uploaded, and we have received to the SBA, and we've received SBA authorization to proceed. We will start funding our first loans today. We expect to process at least 10,000 applications over the coming weeks, or for a total of around, we think, probably a little over $1 billion in funding. A large volume is coming from the Treasure Coast, where we have a very large number of relationships with small businesses. Again, you do not have to have a loan with the bank to be able to talk to us about this. Any deposit account would do. Like many banks, we're focused first on our existing customers, and as our processes speed up and we work through a good part of our customer base, we hope to open up the program to non-customers who operate in our community. With that, be happy to take a few questions.
Thank you. That was, people have been starving for that information, and
Yeah.
you did a very good job.
Yeah, it's been a rough road to put this program together. We've never done this before as an industry. The volume is massively higher than anything we've handled in a short period of time. And I think many in the industry have been hesitant to get too much information out there because we were vastly delayed in receiving information from the government. In fact, the first official information we got other than the legislation that was passed occurred around 6 o'clock on last Thursday evening. We only received the documents from the SBA as to how we should close the loans yesterday.
Okay, great. Thank you for your work. Commissioner Smith.
Denny, first of all, thank you for coming, and to your family, our sympathies, and thank you very much for being here.
Thank you.
So just a couple of questions that have been asked of me that I don't or didn't have the answer to. Some banks are creating their own form. Is there a standardized form, or is it okay that a bank is doing its own form?
The answer is yes to both. Some banks have put together, out of frustration, have put together their own note and documents based on guessing, and have closed a few loans. They've tended to be very small banks that would be using very low volume, I think. But as of yesterday, we did receive from the SBA, all banks did, a standardized form. Another challenge for the industry is not all banks are qualified SBA lenders. And so for you to get access to the SBA system that you upload data to and then immediately receive a response back from, you have to be authorized in that system. And so the process to authorize and turn you on as a qualified lender has been simplified, but they're overwhelmed with volume of banks. This will be thousands of smaller banks that were not qualified as SBA lenders. And the second problem we're running into is the getting the credentials, the licensing, if you will, to more people in the new banks so that they can upload those things. But even in the existing banks, for us, for example, 3 weeks ago, I think we had 8 people working in SBA. Today we have 45. 3 weeks ago, we had only 5 credentials, 5 people that were authorized to use that system. That was more than enough for what we needed. Today we need, triple that. Said another way, we're only able to do 5 at a time once they get all the way through our process to upload to FCB and come back. So it's a bottleneck that they're working on right now. They're doing some work with AWS to open up more credentials in the next couple of. So the reason I tell you all that is I think this flywheel starts turning a lot faster probably next week, and we'll see the throughput increase pretty significantly.
So from your perspective, is there anything we need to do as local government with the federal government relative to that credentialing process, are they, I'm sure that they're aware of the issue, but is there something we additionally need to be asking them for? If we have local banks that are not credentialed or don't have credentialed employees, is there something we should be asking for or doing?
I talked to Congressman Mast's office last night and suggested that, number one, there's a lot of fear out there that the program will run out of money.
Right.
And anything they can do to assure the public that additional funding, as much as needed, is coming, would go a long way to tamp down this press to get my application in quickly, because otherwise I'm going to be locked out. I don't think that's going to happen. I think we're going to be fine, but I think anything we can do to encourage our Congress folks and senators, our representatives and senators, to push that legislation through would be helpful.
So I'm assuming that that was the commentary from the President last night to Congress, that this second wave of funding, and there may be a third and a fourth wave of funding.
And I think that's important. I've spoken myself, and I'm sure you have too, with a lot of desperate folks that are in businesses that are just now getting to or have run out of cash. And that is very frightening. And they're at the point of laying people off, and it's just horrible.
To the banking relationship question, is it as you are hearing from other banks or in the conversation, is it typical that it is a business banking relationship with a bank, or is it just a banking relationship with your bank? Not your bank, but I mean any bank.
There are every bank has slightly different rules around that. The rules that they've created are designed to focus the attention on those that need it very well, the folks we know the best. So I would say in general, most banks have required that you have some relationship. I've read that some are requiring a loan relationship. Others are requiring a small business checking account. Our rule is you just have to have one or more relationships with us. It could be a consumer account that you have, and you also have a small business that you're running. This would definitely be the case with the sole proprietor. So any account you have, that's all that is qualified. The only qualification is that you have to have been in business previously, and then you have to provide us with payroll information so that we can confirm the loan amount.
And Mr. Chair, the last question, is it still a in-person, or can it be done online, or will it be online at some point that people will be able to just merely download all of their information?
Right now, we have stood up two separate platforms that we're using for this. The first platform was up and running by Friday. It's a digital platform we run internally to kind of process loans. The vast majority of the application material has been distributed and checklists from us by email out to our businesses, and then they respond by email with PDF attachments with the information, and if there are questions, it's handled over the phone. We prefer that because of all the obvious reasons. We'll be deploying, we hope, later this week or over the weekend, a even faster digital system that'll take applications perhaps starting next week that will allow a little more direct contact with our customers. We think will speed the process up.
And I think one thing you just stated, and I know from a few people I've talked to, as simple as this may seem, the whole PDF format versus something else, apparently the way that the SBA or whoever is actually doing the review, that's the format that they're going to be taking the file in.
The bank itself is doing the review. All the SBA is doing is confirming that you're not on a bad list somewhere.
Great. Fantastic. Thank you, Denny, very much for being here.
Thanks.
And another fact is that even essential businesses that are operating, have employees over 65 and immune-compromised employees that they're forced to stay home, which is also something to be able to keep them on the payroll.
That's right.
So this is a huge benefit for business.
Yeah.
Any other questions?
All right, just one
I think we're good. Oh, okay, go.
And Denny, I would say the same thing as I said about Rob Lord. Thank you for coming. And we could have a slew of folks from the banking industry, and we would welcome them to come if that were the issue. I think the importance of hearing from someone who's been in our community forever, and forever is a long time, I appreciate that, but
Right.
does mean the world to us and to our community, so thank you for everything.
Thank you for all that you're doing.
Thank you, sir. Really appreciate it. Okay, now we have Carol Howard Dietz from the United Way.
I'm short, so I have to
Yeah,
put it down.
Good morning, everyone, and thank you for allowing me to have this opportunity to be here this morning. I just wanted to give you an update on the nonprofit world and what we're doing. We are working with over 20 different nonprofits and your county departments to ensure that we have the needed supplies for our community. It's been truly amazing to see everyone come together at this time. I'd like to say that there is a silver lining to this pandemic, and that is that at the end of this, we will have learned a lot about each other and we'll have a much stronger system in the future. We have also deployed over 100 volunteers in the community to assist agencies with feeding programs, packing food, making the all-important masks that everyone are looking for. I would ask if there are any sewers in our viewing community that are interested in making these masks. We are getting more orders than we can handle, and so if you're a sewer, I am not. This one I sewed, it's not very good, but it'll work. We are looking for people to help us. The number to call if you are able to help is 283-4800. We do have material. We've had lots of material donated, and you've heard from others that these masks are what people are looking for the common person. If there are any seniors out there that need assistance, we are asking that you give us a call. We have volunteers that are willing to go out and help with shopping, help deliver things, or just they need to talk. Please give us a call. You can also call the county helpline at 287-1652, or once again, you can call the United Way at 283-4800. Or that all-famous number, 211, is another resource for everyone in our community that needs information or assistance. And for financial assistance, we're asking that you call the Salvation Army at 772-288-1471 or House of Hope at 772-286-4673. We continue also to work with 12 other funders to look at financial resources and the needs of our agencies, because they are very important in our community. We have to keep the agencies that are helping the most vulnerable healthy. So we're continuing to look at those applications that come in so that they can operate. And finally, I'd like to thank all of you and the commissioners and your county staff. You have an amazing staff, and it's been so neat to work with everyone and to coordinate and to find the solutions for our community. But people in our community need to know that we're working together, and if you need help, call. There's no reason anybody should go without. We are working together, and you just need to call any of those numbers. Any questions?
Any questions? Go ahead.
Can you give us an update on how we're doing with food distribution, how that system is running?
So, you know, it's big, and right now, I know Rob's here and he'll probably talk a little bit more about it, but there seems to be a lot of fresh fruits and vegetables available right now. We've had distributions in Indiantown, and we have hot meals going out, and the school district is providing the breakfast and lunch. So there is plenty of food to go around, and if anyone is insecure, they just need to call. There's food boxes for seniors, there's all kinds of things. So right now, it looks good, but you know, we don't know what the future will hold, so we're trying to coordinate and make sure that we're deploying those resources as strategically as we can. Any other questions?
I think we're good. Thank you very much.
Thank you for the opportunity.
Really appreciate it. Okay, now we've come to the public comment portion of our meeting. We're going to try to stick strictly to our 3-minute time limit to respect everyone's time. Other than Mr. Ranieri, is there anybody here that's not going to talk about golf? Okay, that makes it easy. Okay. Mr. Ranieri. Yeah, well, you may want to talk about golf. Yeah. Go ahead, talk a little golf.
Good morning, Commissioners. Thank you for the opportunity to be here. Just to elaborate a little bit on what Carol just said and answer Doug's question in some more detail, there is a lot of fresh produce that's coming into the market, really a result of the downward trend, obviously, in the restaurant and hotel world. Just yesterday, for example, House of Hope pushed out about 5,000 pounds of fresh produce to all of our food partners, plus the hundreds of pounds that we distributed through our facilities to our clients. So that's been a positive, I guess, if you will, out of all of this. I think the challenge is meats, because a lot of what we get in our world comes through sort of the secondary markets. Things that don't sell in the big stores come out to us. With everybody rushing and hoarding, it's been tough to get some of those products in, but now that the stores are starting to normalize, I think our distribution capacity will normalize around that stuff as well. So overall, food is flowing. There isn't a lack of it, and it is pretty organized, and I think that really goes to a lot of what the nonprofits are doing. There's been great pivots in our community. Boys and Girls Club, although their clubs are not open, they've jumped in and they're getting dinners out to their club kids. It's not just the food, but it gives them a chance to put some eyeballs on their kids and make sure everything is okay at home, and just keep touch with the kids. They're doing some virtual activities now too for the clubs to keep kids occupied and interested at home. Banner Lake Club's doing similar things as well, and they're actually touching a lot of the seniors in their community, making sure they have what they need, and really easing some of the anxiety, I think, of the seniors in their community as well. In the mental health world, Tykes and Teens it was almost instant how quickly they pivoted to virtual health support for the mental health support for the people that they support through this crisis as well, and doing great videos, also getting good information out for the public to have. I know Inner Truth Project did the same thing. So the nonprofits have really kind of risen to the occasion, figured out how to adapt and move forward and continue to provide pretty high-level service. And so hopefully that will help us as we get to the end of this process eventually, where there hasn't been big gaps in opportunities for people who need mental health, physical health, food, case management. All of those things are still happening. They're just happening in a different way. So I think that's been a testament to the organizations we have in our community. A lot of great strategic thinkers in charge of the nonprofits in our town that have really, we always work together, but it's happening at a much higher, greater level. Again, using technology, using whatever resources available to be able to deliver the services that are necessary for the community. So that's the update on the ground. Thank you.
Thank you, Rob. Okay, now let's talk golf. Let's start with Mr. Bob Raines.
First on the tee.
First on the tee. Good morning, Commissioners. For the record, my name is Bob Raines. I'm an attorney with the Gunster Law Firm, and I'm here today representing the Dye Preserve Golf Club, which is a high-end exclusive golf club in a gated community down in South County. As many of you know, also in my prior life, I was a PGA golf professional for 15 years and still a proud member of the PGA of America today. So I have a little bit of understanding about the game of golf and golf facility operations. These are difficult and unprecedented times. I know you all have a lot on your plate, a lot of tough decisions to be made, but we're here today asking that the golf courses in Martin County remain open. The governor's executive order, when he issued it, I think recognized golf as an essential recreational activity, and I think he did that for a number of reasons. We still have to have, our citizens need exercise, they need recreation, and they need a distraction from what's going on in the world right now. And I think what he recognized specifically with respect to golf was the fact that it can be played and done in a social distancing protocols being met. So I think that's what the difference is with tennis, pickleball, where they share equipment, share balls, you can play golf, you can have the social distancing. And I think that's why he recognized it, and most of the executive orders I've looked at around the country are also recognizing golf as an essential recreational activity. The Diet Preserve is requesting that golf courses remain open for a couple of reasons. One, they want to keep their employees working, and also they want to service members and provide them with the opportunity for exercise and recreation. But their number one priority is to protect their employees and their members. To that end, they, with respect to their employees, they have a gun. They take their temperatures. If anybody's suspected of having a high fever or anything, they send them home. They're asking their members also to volunteer to have their temperature taken. They have approximately 270 members, and only about 100 of them are currently local right now. And they're not taking any outside play or allowing any guests to come in with their members to play. They've changed the nature of their operation significantly since this has occurred. They've gone from being a full-service facility where they put the clubs on, they do everything for the members, they're handling everything, to basically a self-service operation. Really what they're doing now is they're just opening the golf course up for play. And they've been following for some time the guidelines on their own of the PGA of America, the United States Golf Association, and the Golf Course Owners Association. And those are the kind of things where they have members riding in carts by themselves, flag sticks remaining in the hole, the cups are designed now so that the balls don't go all the way in the cup. And I would also just add that penalize those who are not following the rules, not those who are following the rules.
Thank you, Mr.
Thank
Raines.
you.
Kevin Murray.
Kevin Murphy, Director of Golf, General Manager of MacArthur Golf Club in Hobe Sound, Florida. I want to thank the commissioners for giving us an opportunity to speak. Just to echo some of the things Bob has said, you know, the golf industry took upon themselves to make a lot of changes. If we look at a timeline, back on March 15th at MacArthur Golf Club, we stopped allowing members to have guests to play. Around March 22nd, we shut down the clubhouse. We shut down our food and beverage service. We sent emails out to members to let them know, if you're coming down from the tri-state area, New York, New Jersey, Connecticut, you must self-quarantine. The golf industry has done a lot of these things on their own without being told what to do. As Bob said, there's no rakes on the golf course. The ball doesn't go in the hole. We have single carts. The staff is sanitizing the golf carts continuously. And this is going on all of the private clubs in Martin County because we all stay in touch. If it's the PGA of America or the Club Managers Association or the Golf Course Superintendent Associations, we're sharing ideas. We are looking out for our members and our staff. Right now, we still have 50 employees that we're paying. We've broken their shifts down to shorter hours, but still paying them for 40 hours a week. I think it's very important that we keep golf going in Martin County because it's total social distancing. We have 190 acres of turf out there. We might have 50 golfers. If I'm going through my neighborhood on the sidewalks, there's a lot more people crossing a lot closer than they are on a golf course. I feel very safe at MacArthur, and I know other golfers do at their clubs, a lot safer than I do at Publix or pumping my own gas. I thank you for the time, and I would implore you to please come visit these private clubs and see what we're doing, because I think you would say, wow, they're taking measures I never thought of. Thank you for your time. Any questions?
Thank you, sir. Michelle Riley.
Good morning, everyone. Michelle Riley from Willoughby Golf Club. I'm not going to repeat what's been said before. I also communicated with all of you via email, but a couple things that have not yet been said. Think about who moves into a gated community. What is that person looking for? They're looking for rules. that exist, the ability to make their own rules, the ability to enforce those rules. They are accustomed to making, following, and enforcing rules and regulations and standards that everyone in the community has agreed to abide by. Differentiates us a little bit from the non-private clubs. They're also naturally gregarious. They join a club because they want to hang out with people. They're friendly. Personally, I can sit on the couch and read a book for 3 days and never move. That is not my member. They need to interact with one another for their own mental, social, physical well-being. I know every member on my golf course today. I know them by name. I know where they live. I know if they've traveled recently, and if they have traveled recently, they're not there. So we have increased capacity to regulate their behavior. Think about if, especially in a gated community where the golf course is out the back door. Should you make an attempt to shut down golf, if a member walks out the back door with one club and one ball, is that golf? They walk on the green behind their house to practice putting. Will that be permitted, not permitted? Does 2 clubs change the dynamic? What about a carry bag? What about a member, by definition for us, who is handicapped and entitled to drive a golf court because they are disabled? Does that change the makeup? You're treading into very complicated waters, and I think no one is better equipped to answer these questions and regulate these behaviors than the general managers and the staff that manage these clubs on a day-to-day business. We've talked amongst ourselves. We're more than happy to take on that responsibility if you give us the opportunity. We do it every day anyway. So we're looking for the opportunity to continue self-governance. Another reason many people moved inside our private communities. They like and accept the responsibility of self-governance, and as an employee of the club, I'm happy to accept the responsibility to administer that. Thank you very much.
Thank you. Nancy Lopez Russell.
Good morning, Commissioners. First of all, I want to say my heart is going out to everyone that's having to deal with this, the coronavirus. It's something that's very terrible and breaks my heart that so many people are struggling and having to go through it. My name is Nancy Lopez Russell. I played on the LPGA Tour for almost 30 years. I love golf. I think it's something that's very healthy, especially for a lot of people to do. I live at Piper's Landing. That's my club and my home. And I'm here to talk about golf, hoping that we will keep our golf course open and other golf courses that follow the CDC guidelines. I'm going to tell you a little bit about what we do at Piper's Landing. We are a private club. We have control over who goes in and out of our gates in our community. We have the ability to regulate what our members do. And the thing about golf is we have, on our golf course, no organized events. I think we've learned through the months what we have to do and how we have to change. Everything is closed except for takeout, which we were trying to keep our employees employed. Our clubhouse is closed, our pro shop is closed, our patio is closed, and our snack bar is closed. Guests are not allowed on the golf course. If there are guests, they stay in the homes that they're visiting. Everyone is riding separately, except spouses and significant others, and I think that might change. I'm not sure. We have styrofoam inserted in the cup so people don't have to reach down and touch the pin. So we're really trying to stay aware of not touching things and touching things that other people will be touching on that day. They've eliminated the rakes from the bunkers, and people are carrying their own rakes on their golf carts. So we're always encouraging each other to protect each other and not touch anything that's out there that's not ours. Socially, we do not have an outside bar. Again, we have no more organized events. When golfers are done playing, we have someone there to direct them to leave the premises. I believe that golf is an essential activity for everyone, especially the elderly, and I would consider myself elderly now. So it's important to be able to get out on the golf course and enjoy the sunshine, and there is social distancing on the golf course. You do not have to be close to each other. I think it's also essential for the well-being and health of so many people, and so many people love to play golf. I feel we are following CDC rules of social distancing, so I am hopeful that you will consider private golf clubs and golf clubs that follow CDC regulations, and that you will let us keep playing golf during this difficult time.
Thank you, ma'am.
Thank you. Thank you.
Brian Rich.
Good morning, Commissioners. My name is Brian Rich, and I've had the pleasure of being the General Manager at Piper's Landing in Palm City for the past 14 years. I'd like to thank the Chair, Commissioner Jenkins. I think following Nancy Lopez is the most difficult act I've had to do in a long time. I would like to, I'll skip around because Nancy already read my speech, but one of the things that we focused on, as Nancy touched on, is guests in the community and the fact that they've basically been quarantined to the owner's properties since March 20th. We are doing everything we can, as my colleagues before me have said, about sharing information, getting ideas about how to shut down both and minimize operations such as food and beverage and golf. We are literally a private community managing a private golf course. Only members, one at a time, and doing our best to keep them socially distant. As Michelle said, we are happy to take on the responsibility of continuing that, as that's our job on a daily basis anyway. Nancy did mention that our clubhouse is shut down and our food and beverage services takeout only. That is a convenience for both our residents and our staff who we would like to keep employed. We've offered some to furlough, and even those that would benefit have asked to stay on the job. So we're happily accepting those. We respectfully request you allow us to continue with golf on our course, and we will do everything we can to control play as we have and follow all of the approved guidelines. Many of our residents are of an age where biking and hiking are just not viable alternatives for them. Our desire in these difficult times is for golf to continue, as it's in the best interests of our residents' mental, physical, and emotional health. I thank you for your time.
Thank you, sir. Colleen, yeah, I'm not even going to try. Please state your name for the record.
Thank you. I'm Colleen Katter-Heinrich, and I come from the state of Minnesota. We recently, last year, purchased a home down here at the Summerfield community. My husband and I enjoy golfing, and we enjoy biking and swimming and everything here now that we are retired. I am I would say the social member for the Ladies League at Champions Public Course. We have sometimes up to 28 to 30 people, but now we have a lot of them have dropped back. We are asked to take our own carts if we have them. I have told the ladies that they should bring their own wipes, even though they do clean the carts. There's only one person per cart. They have taken all the water stations out. They have also, again, what Nancy had said, everything is kind of spread apart. And we are on the golf course. I'm also a physical education teacher and also a health teacher. And golf is a wonderful activity for all of us that can enjoy it. And like she said also, or he said, some people are not able to be out and biking and walking. I do those things also, but I'm farther away from friends when I'm out on the golf course, even though I have to swerve with my bike, etc. So I do ask you, Champions is doing a wonderful, and they're a public golf course. They're doing a wonderful job there. We don't touch anything with, pavement, and we also are wearing masks as we go in. We have our wipes as we go out. The ladies all have the wipes. And we also have our masks. I have a picture of 2 of us on Tuesday wearing masks. So I just employ that. All of you that are doing such a wonderful job here, allow us to have this time out in the sun. Thank you.
Okay, and my last speaker form is Mr. E.J. Ewing to bring us home. That's why I left you at the end.
Mr. Chairman, Commissioners, thank you all for everything you've done. And Mr. Chairman, I'm not sure how it works, but I think I was the first one to fill out a form.
I'm sorry.
And obviously, everything I'm going to talk about now has probably already been said, but I do want to focus on our community for just a moment. I'm with Sailfish Point. I'm the general manager there and have been there for over 12 years. I do want to tell you, I think I sent everybody a copy of our most recent communication that went out last week, so you know exactly what it is that we are doing at Sailfish Point. And it covers most everything that my counterparts have talked about already this morning. I do want to just mention that instead of social distancing, we also talk about social responsibility, which I think is huge. And it's incumbent upon all of us to practice responsibility as well as distancing throughout this entire process. I think we like to say that we are following all of the CDCs, all of the executive orders, all of the mandates, whether from the county, the state, or otherwise. I think we go above and beyond with what we try to do. Our goal is to attempt to keep our members inside our gates. I think Rob Lord or somebody mentioned earlier today about people having to go out, even going to the grocery store. Not only do we do our takeout programs for food and beverage, but we also do our pantry program where you can have groceries, where we deliver those also to try to keep people from having to leave our gates. As Michelle noted earlier too, we are more than capable of policing and enforcing our own rules and regulations within our communities, and I think we do a pretty good job. I think most of you have been to these communities. I think you've seen what we do and what we're capable of doing. I won't go on because I think everybody else has been covered, but I do ask you not to punish the masses based on the activities of a few. And I think that it's incumbent upon us to go after those that are in violation of these types of activities versus trying to punish those of us that are trying to live within all of the guidelines being set. Thank you very much.
Thank you, sir. And that was our last speaker form. And I suspect Commissioner comments is going to take more than 4 minutes to get to our break where we for our closed captioning. So I think now would be the appropriate time to take that break. So we'll see you in about 10 minutes.
So we're going to do Commissioner comments and then comments on this, or that's all one thing?
Whatever you want to do.
I'm just asking.
I suspect the Commissioner comments will evolve into a discussion.
A larger discussion?
A large discussion. So anyway, 10 minutes and we'll be back. Thank you. into the golf course issue now. Mr. Stokas has some thoughts, so does our county attorney, Ms. Woods. Mr. Smith, would you like to kick it off, or I don't know how?
No, I would just, I mean,
go ahead, George.
I do have a commissioner comment this morning, but after this, that's fine.
Okay. Yeah, that's what I'm saying. Let's do commissioner comments after we have this, and then we've got to revisit parks also. So, and then after that, we'll do commissioner comments.
Mr. Chair, George Stoke, Assistant County Administrator. The reason I wanted to come forward today is just to give you an update of what staff has done as of Wednesday. On April 7th, Tuesday, April 7th, we contacted what we believe the total of 33 golf courses, of which 28 courses confirmed receipt of our message. 10 responded back that they were following best management practices, and we had confirmed that 5 were closed. Also on between Tuesday, April 7th and today, in talking with the Sheriff's Department, they have confirmed that they have visited all 33 golf courses and have reported that all 33 have a plan or have closed play. And I can say at this point there are 5 closed, and that's really all that staff wants to point out. Attached to the message was the National, I just want to make sure I get it correctly, the National Golf Course Owners Association's best management practices for making your course socially distanced and ready. I also know that the United States PGA also has a message out there, and that most of those golf courses had said that they had received that. And that's my report, sir.
And Chair, if I may add on to that, in my communications with the sheriff, and I know I've been asked by a few commissioners, they physically observed each of those golf courses and made sure that they did have a plan in place. And they said, what they told me was that all the golf courses that they visited, and every one, was adhering to those guidelines.
Ms. Woods.
The only thing that I would add, and I'm, again, looking for board direction of what you would want to do, but I do want you to be aware that using your broad declaration of emergency powers, the board could direct an emergency order be issued that would require those various policies and also provide any other limits that you provide that board direction for. And then at that point, the sheriff would have the ability to enforce that emergency order as well. And while I understand the governor has his executive order that copies statewide or that covers statewide, anything that's more definitive that our office could prepare for you and could be provided to the sheriff and to other law enforcement throughout the county would also be something that you all, with your input, that we could do.
Question.
And we also spoke very briefly back there about the idea, I mean, the biggest concern reading all the hundreds of emails we're receiving is making Martin County a destination and limiting, potentially adding on to requiring the best management practices that have been published, also adding on to that it would be only that golf would not be open to Palm Beach County residents. Is that?
Yes, sir.
Or not, but out of county. It would only be open to Martin County residents.
Yes, sir. And of course, as with all things, the devil's in the details, but we would need to get into how we define Martin County residents. Is it a driver's license? Is it a electrical bill? Proof that, because we do have some seasonal residents who are living here. I'm just kind of looking for your direction on that, because we do have people that are living here, are not coming from somewhere else that live here. And how exactly we would verify that, I'm not sure, but I believe it's legally defensible to say that we're all safer at home. We need to limit the use of the golf courses, should the board decide to keep them open, to people that actually live here.
Well, the majority of clubs we're talking about is a members-only type club. So really the clubs that take outside residents, whether they be from Martin County or anywhere else, is the question. They've usually got to drive there, so you would think but they could be from, yeah, I get it. So any other Stacy, did you?
Trying to remember now my question. So the social distancing guidelines, you mentioned the sheriff was at pretty much all of the courses inspecting, and they all had a best management practice plan. So if there were to be a complaint, the sheriff's office is enforcing that complaint, correct? And those complaints would be, the same penalties would apply if someone was out and, say the sandbar there were 10 or more people, the same penalties would apply should there be a gathering of 10 or more at the golf course, for instance. That's a question.
Yes, ma'am. My thought here is, depending on what your board instructions or what your policy decisions are, is that it would be helpful, because it appears to me from reading the emails that there is some level of confusion about what the guidelines are and what the professional associations associated with the game of golf are recommending. So, for example, everything that we've been able to find, it's one person per cart. All flags must be removed from the holes. So, it is possible to determine, I've got one here with a number of, it goes from A to II, that with best practices that have been recommended by those professional associations in order to mitigate the COVID virus.
Let her.
Okay, but the sheriff's office is the enforcing agency, and regardless if it happened to be at the clubhouse, the sheriff's office would be enforcing.
Yes, ma'am.
If it happened to be in front of somebody's yard and they had 20 people under a tent, the sheriff's office would be enforcing.
Yes, ma'am.
And George, you've reviewed all the different ones. Do you have a recommendation of one that's the most thorough? How about that?
Well, I think, I don't have a recommendation, but I will say that the park and play program from the Golf Course Owners Association and the recommendations from the USPGA are similar, and some are directed more towards player play versus others are more towards the actual golf course owners. So, I would be more than happy. We feel, we're getting 28 out of the 33 courses. We can hammer down what the other 4 are, and I can send both of these out again. I don't have the PGA in the best format because I went to their website, but no recommendation, just they're both very parallel and very, just a different view. One's from the golf course owner and one is from a player's perspective.
The list that my staff prepared, I believe went to all of those 3.
Yes.
And attempted to.
I'm sorry, I didn't realize.
I'm sorry, tried to go to the 3, the golf course, it's PGA, and I'm trying to remember the other
Owners.
3 organizations, I believe, that the staff looked at to try to come up with, depending on the board's direction, to come up with what were the current best practices recommended for operating a golf in accordance with CDC recommendations.
Yes.
So do we have a copy of that
No.
somewhere?
I'm sorry, I can't. I wish I could get, you know what I can do? I can't see you behind that thing. Go ahead.
Okay, so what I've just learned is that we have in Martin County, a fairly small county, 28 open golf courses with social memberships that are somewhere between 50 and 350 members. I'm disappointed that we're having this conversation, quite frankly. We're talking about niceties versus necessities. We're experiencing, we haven't seen the peak of the biggest pandemic that any of us have ever witnessed in our lifetimes. And no one needs to be playing golf. Social distancing is not meant to be punitive. I'm disappointed to hear that. It's meant to be protective. It's meant to be life-saving. That's what we're trying to do here. We're putting in restrictions into our behaviors in order to save lives. And the only way we're going to end the transmission of this coronavirus is to mitigate and to eliminate human interaction. And I think that it's my strong preference is that we close all the golf courses. It's been done in South Florida successfully. They have infection rates that are scary. We don't have them here yet, so everything that we can do to eliminate increased infection, we need to be doing. Thank you.
Commissioner Campy.
Mr. Chair, thank you very much. This has been probably one of the most commented on and difficult decisions that we've had to make, believe it or not. These are difficult times, and as a commission, we've tried very hard to balance out the demands of our residents. And I hear what Commissioner Hurd is saying, and in its most boiled down form, she's correct. What we need to discuss, because the state of Florida and the governor's office has not taken this approach statewide. He has left us basically to make these decisions locally, which creates a patchwork. Something happening to the south, this is different than what's happening out west and north. I think in situations like this, a consistent statewide approach would have been best. It would have eliminated a lot of the confusion, a lot of the difficulties that I'm sure not just Martin County commissioners are going through, that commissioners throughout the state and the country, for that matter, without strong direction from the top. It requires us to then make these different decisions. The other advantage at the federal level is the president has the ability to meet privately with his advisors and make a determination, and then he comes out and to the podium and says what the federal opinion will be and the policy will be, and that's it. The governor also has that option and that ability to meet with his advisors privately, to brainstorm and discuss the pros and cons and the unintended consequences of every decision and then bring them forward. And there is no person standing next to him at the podium that would say, oh, by the way, I disagree with that and I think you're making a bad decision. He pushed it down to the commissioners. And so we have tried I think very fairly and reasonably to methodically, step by step, go through the evolution of this pandemic. And with that in mind, I think we have done a good job of going through with our staff both what the legal consequences of our decision-making will be, what the practical and logistical consequences of our decisions will be. But I look beyond just the physical health of our community, and I look at our mental health and our financial health. Now, I know some people will put financial health aside, and I think that is a decision that's very personal. If you are fortunate enough to be retired with financial stability, then the issue of should a local restaurant be open or closed doesn't weigh as heavy on you as someone that might be wondering how they pay their bills if they get laid off. The other issue would be if you are fortunate enough to have a job that allows you to work from home. Again, if the movie theater is closed and all those people go home and don't have livelihoods, that doesn't play as heavily on you. I think the issue that is not being discussed, it is being discussed a little bit, but not enough, is mental health. I think at the end of the day, we heard the sheriff yesterday in our county's presentation reiterate information that a lot of us are sadly well aware of, and that the reports to the sheriff's office of domestic disputes are up. Reports of people having to be Baker Acted, which is the forcible confinement in mental facilities, are up. I was just reading in the newspaper this morning that there was a Major League Baseball player who was arrested for beating up his 14-year-old child. The distress and stress that people are going through is something that we cannot ignore, just as much as we can't ignore the physical ailments that are coming. There is also a large tsunami of mental health issues. Children have been completely disrupted from their lives. Families are fighting alcoholism, drug abuse. People that are making decisions that they would not have are being forced to. So I'm letting that also enter into my decision-making process. And if you remember when we spoke on Tuesday, I discussed my ability, if you will, to get with the 7 golf courses that are in my district, primarily in Palm City, and understood that after speaking to all 7 of those owner-operators, that they represented nearly 350 employees that they were trying very hard to keep employed. But knowing golf and having grown up in the golf world as the son of a professional golfer, I understand that there are different types of golf courses, okay? And I think that's what we need to boil down today. There are municipal golf courses that are run by the counties, by the local governments, and we closed ours, okay? That was completely our prerogative, and we did that. But I'm pretty sure that the individuals that were employed through Parks and Rec at the golf course, I would assume we have been able to rework their job descriptions. Not all of them, but some of them have been able to hang on to their jobs elsewhere in the county. Okay? That course was at our prerogative, and we closed it. The next level of golf is what we call public courses that are run by private entities, communities, or corporations. There's a lot of corporations that are involved in the ownership and management of golf courses. I think the other important aspect that weighs very heavily on, and should weigh heavily on, our decision-making is protecting our Martin County residents. I would hope that my colleagues would agree that a majority of the early emails that we received, and not just emails, contact, phone calls, social media posts, and you name it, the comments that we might see on social media platforms, the real issue that most reasonable people had was the ability to stop folks coming here from other counties, specifically from down south. Palm Beach County, Broward, and Miami-Dade are classified as hotspots. Our closest neighbor to the south, Palm Beach County, has approximately, and this is the last time I looked, about 1,200 positive cases, but over 60 fatalities. I take that statistic very seriously. So my ultimate goal was to try to eliminate the possibility of residents, and I understand why they'd want to come here, that their courses are closed, and their courses were closed by their governments based on very high level of infection and very high mortality rates, and good for them to make those decisions. I don't second guess them. However, Palm Beach County being nearly 1.5 million residents to our 160,000 residents makes it very difficult for a small county to absorb even just the folks that are interested in coming up here. Never mind the folks that probably came even from counties to the south. It is not unreasonable for someone that's interested in continuing to recreate or to burn off some emotional steam on a golf course to drive an hour or more to come here. Okay, so I got the Palm City courses to all agree that they would go to a Martin County residents-only policy. And because of that, I think we did very well for a week. Now, the courses that are not in my district, I was hopeful that they would see the lead that the District 5 courses were taking and follow along. And I believe some of them did, but sadly, some of them either could not or would not abide by the Martin County only rules that we tried to put in place. I'm happy to hear, and I have some additional questions on the investigative authority that we would give the sheriff, the shutdown authority we would give the sheriff, and then the proof of residency requirements, because that cannot be left as a unanswered question, because then we're basically forcing these golf course operators to make up their own rules if we can't figure them out directly. So with that in mind, I think it's our responsibility as commissioners and as the local government, we basically have to create regulations for the people that are breaking the rules and the ones that are not following along, versus creating regulations for the people that are doing exactly what the CDC has mentioned and what the Professional Golfers Association and the USGA are recommending strongly. A week ago, I was in favor of leaving the golf courses open with the Martin County residents only. this last Tuesday during our regular commission meeting, I was prepared to be a lot more stringent and strict on that. I did have a conversation with our legal department and ask if we would have the ability to, and what I was asking earlier is the shutdown authority. Do you punish every operator if 3 or 4 of them are not following the rules? Do we eliminate it all for that? Now, if they are able, I believe golf personally is a socially distancing activity, especially if they follow the new criteria of one person, whether it's a husband or wife, one person in a cart. Okay, I think most people that have had any experience playing golf understand you're not standing right next to the person as they are teeing off, because they're swinging at least a 3 or 4 foot long golf club. You're not standing next to them. You are not standing next to someone in the middle of the fairway, because when you tee off, the balls traditionally go in different directions, so you're not right on top of the other person. When you get to the green, it's poor golf etiquette to stand directly next to a person that is lining up or putting. Okay, so the rules in terms of after the round of golf is over, if you go up to the patio at the clubhouse and you're sitting around socializing, I think we've heard this morning from the management teams that are represented here that they can put an end to that, even if it means, you know, having to go out and say, people disperse, you can't be hanging around here. Even if they're just socially standing around, I think that the clubs deserve the ability for us to give them the benefit of the doubt. So with that in mind, I think that the physical activity that is benefited from golf is still an option. I think we need to work collectively this morning to create the rules that would make it exclusively Martin County residents. The other thing that I think that is important is the differentiation between private, and semi-private and public courses. The folks that came and spoke this morning, nearly all of them, represented organizations where their residents are their members, and their members, for the most part, are their residents. And just like the issues that we're having with boat ramps, if a community had a private boat ramp in their neighborhood, or a marina, or some communities that are yacht clubs, we are not regulating how people are able to put their boats in the water. We don't have any restrictions on a private community putting boats in and out of the water, but we have eliminated the ability, for the most part, for our boat ramps to be utilized, and I think that's fair, because boat ramps and boating is another obviously social distant activity. We closed down the other day tennis and pickleball and team sports and organized sports because it's nearly impossible to have social distancing or not to touch the equipment that's necessary for those sports. I would hope that we could have a continued discussion on what my colleagues would find to be fair. And in my final comment in this round, Chair, is the fact that we can make these decisions as we follow along on this process. If the governor changes his mind and his direction on statewide regulations, we will abide by those. I think reasonable people would understand if we continue to see a dramatic influx in our cases, we would abide and alter our course appropriately. I think that I can feel comfortable if we were to go through these processes and these changes that we are putting upon our residents incrementally, sharing our rationale on why we were doing it. Our reasonable members of our communities will understand what we're doing. I think the emails have all said they understood that these were very, very difficult decisions that we were being forced with. I would say probably the most difficult decisions that I've had in my nearly 8 years as a commissioner. So I would hope that we can have a constructive conversation on how these things would happen, and that our staff would be able to work with us on what level of enforcement and investigative authorities we might have. Thank you, Chair.
Okay. I had a question, but I wanted to hear. Oh, I'm sorry.
Well, I would just be remiss if I didn't communicate to you the conversation I had with the sheriff yesterday. The more things, if you will, that we are layering on him to enforce, the thinner his resources are. So if we're going to try to somehow craft something that lays out specifics, and to Commissioner Hetherington's point, you know, if people have a group of folks congregating in their backyard, obviously you would want to reach out to him. But we're asking you don't call 911. They have a non-emergency number that you should be utilizing. But I'm just concerned that we've got individuals out there that are, I call them the tattletalers. You know, they want to turn in their neighbors or individuals that are a challenge for them in the neighborhoods anyways. And I'm sure that the gated communities that you have here know who they are. So it's just for the sheriff's benefit, since he's not here to speak. I just think that as we move forward with any of these, even when we talk about our other recreational facilities, the more things that they have to keep track of, the harder it's going to be for him to enforce.
I understand that, and also it's nothing to be said that if we do craft something which doesn't work, we can always change that next week, because we're having these meetings once a week. Commissioner Hetherington, did you? No. Commissioner Smith.
Sarah, do you have, or George, who has the list of the compiled list of regulations or data? I mean, I think it would be, George said he had like 2, Sarah said you had 3 that staff had compiled.
I have the park and play program that I can hand you all. I don't know if you want.
That would have been helpful.
Yes.
Just so if we were going to make a motion to adopt something, it would be nice. I mean, I don't know if we even want to put it up on the screen so people could see what it is we were talking about, that here are the 20 things that we would ask, or if we were to make a motion to do something, you know, presumably if we adopted a list, we would mail a list or email a list to every golf club and say, these are the new rules by which you have to operate under.
We did that.
Okay, do we have that list?
That's what Mr. Stokes is handing out. We sent an email to all of the contacts that we had at the golf courses with this information, and I'm not sure what the content of the email was, but we did that. That's what Mr. Stokes said on Tuesday and Wednesday.
Okay, I'm sorry, I hadn't seen it or didn't know we'd done that. So the first I'm hearing this morning that we have a collective list is fine. No, I guess.
We do have a list of every golf course in Martin County now, which is, we believe is 33 courses, of which 5 are now currently closed.
Right. But the list I'm asking is the list of rules that we would.
I think what I would ask, Commissioner, and again, I didn't have any board direction coming in here, so it's virtually impossible for me to be prepared for any idea. We had begun looking at some sort of a draft emergency order that would address the issue of golf courses. So, and I apologize, this is just a draft that my staff was looking at, trying to look at the various professional organizations governing golf, the one Mr. Stokes is talking about, as well as a few others, and to, I guess what my suggestion would be is if this is what you were thinking of doing, you direct your professional staff, Mr. Stokes and I, and to come up with that list. To sit and try to craft it out during the meeting, I wasn't anticipating
yeah, no, Sarah,
that.
I'm sorry, I didn't mean to craft it out here. I just,
yes, sir.
You all have spoken in sound bites, and each of you have added a piece, which leads me to believe that there was a list, and so there is a list.
Oh,
at least George has.
We have at least, I apologize, I'm interrupting. We have at least 3, maybe 4 sources of professional organizations that have come out publicly and said these are the ideas. A lot of them duplicate each other, a lot of them do not. Mr. Stokes?
I think I can give a little bit more background. So the list that is in your hand I received from, I believe, the Hobe Sound golf course. It was a prominent golf course in Hobe Sound. I apologize, I don't know the name of it. I further got clarification from some professional golfers in the community to go to look to the USPGA site. I have used those two sites and I did not send the link out to the PGA site because it appeared, and I've received 8 responses in the affirmative from golf course owners, that they are following this National Golf Course Owners Association's social distancing park and play program. So that's what we were communicating. I've shared this with legal. I think they've also looked at, there's USPGA, there's PGA, there's other forms, and there's a lot of similarities there. It does appear from the Golf Course Owners Association, they all seemed very receptive to the sheet that I gave you. I don't know if it's completely exhaustive. It probably, like a lot of things, is changing. But this is what we have. And then the PGA has just a different perspective from telling the player how to play the game of golf versus the park and play program tells the golf course how to run the golf course to be COVID friendly. But I also can confirm you, I've had our staff look basically from Google Maps and identify every golf course in each one of your respective districts. We've tried to get phone numbers and emails in order to communicate quickly this message. We've only had a couple kickbacks. I've had 4 kickbacks from email, but we can probably track those down, find out who they are, and make sure this message gets out there. So I hope that kind of brings some clarity.
It does, but all I'm trying to get to is if we were able to adopt something today that would, versus giving direction for you all to put something together for next week, so if this has been vetted by our staff, by everybody, and everybody's comfortable with it, I don't know if the public has seen this.
I think what's important to understand is that
Speak into
the
the
way
mic.
the way that this works under the declaration of emergency is the emergency order is issued by the emergency management director. Certainly in Martin County, we do that, having received clear direction from our Board of County Commissioners. So the board would provide us with the clear direction, but I think I would ask you, I understand people would want to know what was in it, but I think what we would say is we would be following what the professional organizations were recommending. We would craft a very clear emergency order that would set forth exactly what it was. We would distribute it to everybody and anybody that would want to look at it. We would make sure it was clear to understand. We'd already consult with the Sheriff's Department, and then that would be issued. It can be done without the board taking specific action.
Right. I guess the only nuance to all that, Sarah, I appreciate all of that, is that our public holds us accountable.
I'm sorry?
Our public holds us, the 5 of us, accountable.
Oh, yes, sir. No doubt.
And I mean this with saying to you all, go off and you all take care of it and let emergency management put out the order is not going to float well with our public, because if I don't know exactly what I'm agreeing to tell you to do, I read through this quickly, sort of glanced through it, but I can't tell you everything in here I know is, I'm taking some assumption here, but it's odd that we would do something like that we would say to you all, just go off and take the 4 or 5 recommendations, compile it all, and we'll be happy with that.
I understand,
It just puts us in an odd position when people are
We did
looking.
follow that approach when we developed a policy for holding virtual meetings.
So
But
to carry that further.
if you don't want to, that's fine.
Last Tuesday, we made 7 motions on specific items because we couldn't do it as a group motion because the 5 of us couldn't agree to a group motion, so we did 7 or so individual motions. We didn't say to staff, you all go handle the Parks and Rec department and let us know how that all works. I'm just,
I think what the difference would be, Commissioner, just in my humble opinion, is that unlike deciding whether or not what you would be closing up, that you have your control over. These restrictions emanate from professional organizations
I got it.
who make it who make their recommendations relying on science. And
I'm sorry,
I'm not
I'm not
trying
communicating well this morning, and it's not working.
No,
so
it's okay.
I'm
I
done.
don't think I understand.
Ms. Hetherington?
So what I heard, and I understand your point, Commissioner Smith, but what I heard earlier was the sheriff's office already went to each golf course and basically reviewed a best management practice, which should look something to this for each golf course. So in my mind, if we're going to continue and leave the golf courses open, I'm not interested in necessarily creating a new best management practice for each golf course. What I would be interested is more along the lines of the very simple things. How do we craft something for residents only? How would we document residents only? And what investigative authority, similar to what Commissioner Campy, I don't think that we should reinvent all of the USGA's guidance rules, or do I think that our sheriff's office would go in and enforce, say, remove bulk scorecard, pencil and tee holders? I think one of the speakers mentioned earlier that the Gated Communities Act has really their own best self-regulators. So if they are violating their own best management practice, I guarantee that another resident is going to call, and that's going to be an issue that they're going to self-regulate. I think from a high, if we choose to keep the courses open, then we have to operate at a higher level. I don't believe that law enforcement will be able to look at one document if we pass something like this and go in and enforce all of these things. I think that's the course's jobs, and we either decide open or close, and residents or not, and how we might enforce that is my opinion.
The Sheriff's Department already has the ability to enforce the CDC guidelines, which is, this is an addition to, basically. So I agree with Commissioner Hetherington. I think we have some specific, go ahead, George.
Mr. Chair, I apologize. I may have miscommunicated. What staff was trying to, in my understanding, what we were trying to do was to create some commonality between golf courses. You have one golf course. I think just like in the county, you have golf courses that are trying to treat each course on a case-by-case basis that best meets their members' requirements and safety. And what staff was trying to accomplish on Tuesday was to send out some type of scientific or outside professional organizations' thoughts on best management practices. My understanding of what the sheriff did is that they just went out to each golf course and made sure they had BMPs. Now, do those BMPs match exactly what we've given you today? Probably not. There's probably 33 different sets. But are they all of the same hue? Probably. There are some folks in this room that communicated back to me in the affirmative or positive, and even gave us some better ideas of what they're doing in regards to carts and some members and those type of things. So that's what staff was trying to do, and I think we came realizing that you all would have some opinions that would go from all the way from golf course closure to restricting it to members only type of courses. So this was not intended to, and my understanding from legal is this is the rules, these are how, this is better than anyone else's rules. This was just to get everyone on the same level at a minimum of this is setting the bar of what, the the NGCOA and the USPGA are expecting or are recommending, because I'm not an expert in when it comes to golf, because I still hit it 500 yards to the right every time I swing, so.
Harold?
Yes, sir.
So to that point, my thought was, after hearing you speak earlier and then again in the prior conversation, the calls I have received are people trying to understand the clarity of what we are enforcing or not enforcing. I mean, the majority of what I get from people is trying to understand where they fit within the rules. I think a super appropriate way to do that from the county's perspective would be to adopt a set of rules that we issue to all 33 golf courses, whether they abide by it or not. At least from us, you can point to a document that says, look, this is at, you just said, George, as a minimum or as a level, a set of standards that we are expecting you all to participate in. That's just at a baseline of a conversation. That way you could point any one of the 33, any one of the 5 of us could point to them and say, see this document. The governor has done that with us with his orders that he has issued to us and his frequently asked questions, which has trumped some of that issue. The reason he's done that is to give us clarity as to exactly what we can expect from the state government. My sense is that it would be helpful for everybody to be operating under the same rules, and that way if anything were to have to be enforced, you could point to a standard set of requirements that said, look, at the very baseline, you've got a set of requirements to go by. And then the other discussion about how we justify who's a resident, who's not a resident, I think that's another conversation. I just think getting this done would be important today to have done. And if this isn't the final list, fine, go figure out the final list. But I just think having a standard would be super helpful for all of our residents.
So explain to us how you would like to go about that. Would you like to go line by line down this document?
Have you all had a chance to read it?
I skimmed it.
And is there anything you find in there objectionable?
No.
Then I would move that we adopt this as our guiding principles for our golf community.
And we're going to change the language from encourage golfers to golfers will.
That was just my question. I apologize if I'm interrupting, but this document that you're holding is more of an encouraging, maybe you want to...
It's completely unenforceable.
Yes, ma'am.
Completely.
It's not written to be mandatory. It's written to be, you may want to consider this or consider that.
No, but every one of us that gets a call relative to what am I supposed to do and how am I supposed to operate my course, you could at least point to this and say, here's a set of standards.
Yes, sir, and to that end, what we certainly could do without putting it into a emergency order is we could develop a best practices document, happy to do so, circulate it amongst the board so you all could look at it. You've got another meeting and we could make this, make this available and however you want to discuss it. It doesn't have to be, and I didn't mean to say, in an emergency order so that the sheriff has to enforce it. We can say this is best practices. This is how you keep the golf courses open if you follow these requirements. That helps. Maybe not.
I agree. So
And you could look at it.
are we past this and we can move on to, I can't see you over there, to how to identify a Martin County resident?
Mr. Chair, question on this. We still need to get into our situation that, let's say we adopt these rules, and our legal department crafts them in such a way that they're not suggestions, that they're rules that must be followed. We still need to figure out the investigative authority, because we can't just go, like, if someone notices something that they don't like in their community and they dial the police or sheriff's office in our case, maybe not dialing 911, there are other phone numbers that are non-emergency phone numbers. The deputies normally would roll up and do some type of an investigation. We cannot chase down every email or phone call that we get from someone that says, I saw something. So I think we need to have that contact. I mean, obviously the residents are witnesses and see things, especially within gated communities that outsiders won't be able to see. So to that point, we need to have the ability to have some investigative authority to go in and see something. We can't just take a single, because there is people, and rightfully so, that want none of this. They want everything completely shut down. They have a mindset similar to Commissioner Hurd's that shut it all down, okay? And I appreciate and I understand that personal opinion. So how do we differentiate between someone who's got an axe to grind with their club management versus a legitimate issue?
Well, the only investigation, is going to be what the CDC requirements are now. I mean, really, what beyond that can the sheriff investigate?
No, I understand. I know once we create the rules as they will exist, how do we know that someone was genuinely breaking those rules? what investigation is necessary. You send a sheriff's deputy in there, whose word does he take? Someone at the club says, oh, absolutely not, we were not doing that, but there's 3 or 4 residents standing there that said, well, we witnessed it. This, if we can't figure this out ourselves right now, how do we expect to have this figured out on the street or at the course? The other issue is, let's say we do an investigation, or whoever is the investigative authority does that investigation and realizes that they're breaking the rules. Because over the last weekend, we had some folks that were breaking the rules. I mean, it was obvious. So with that in mind, what teeth does what we're doing have? Do we have the ability to shut someone down? The Department of Business and Professional Regulation, they have a set of rules that restaurants and hotels have to follow. Okay, they have inspectors that can pop in and notice these things if they're being practiced appropriately. And then they have the ability to shut these restaurants down on the spot. Are we giving the deputies the authority to shut a place down on the spot? Because if we are, I need to know that.
I think you could give that, again, it's a delicate balance because we respect the sheriff and his authority. So at no point does the county ever, even when in the enforcement of our ordinances or our state law, do we ever presume to instruct the sheriff how he's going to enforce these. So the deputies, and under the leadership of the sheriff, have that ability, just as I think he explained to you last meeting when he was here, which was, he may have a policing instruction of how he comes in and says, excuse me, I think you're violating this. I believe that that's what happened initially with the restaurants. You shut down the restaurants, and then maybe a few of the restaurants did not really understand what takeout and the ability of sitting outside meant. And I know in particular, there have been restaurants that maybe they hadn't really thought about it. They had seating outside. Then it turned out that people were using that seating outside to really have an outdoor restaurant. Well, then they take their chairs up. So I think it's a continuum. I don't think there's any ability, quite frankly, with any law to have absolute answers to how things would be done. I think we rely on our sheriff to decide how he wants to enforce. I think, though, when you have a business, a golf course if it was, that repeatedly or more than once or had a blatant violation of what the regulations were, of course he could shut them down. He has that ability.
Thank you.
We don't instruct the sheriff on how to...
Mr. Chair, may I offer some clarity, hopefully, possible clarity? I don't know about my colleagues' history in golf, but I would imagine we don't have a lot of other golfers up here. This list is terrific, okay? And it's sort of a guideline for clubs, both management, ownership, and professionals to regulate. But I don't think we're going to need to send the sheriff's deputies in to say that they were rakes in the sand traps. I think to add some clarity, we should allow the sheriff to enforce the CDC guidelines for social distancing. If you're gathered more than 10 people up on the patio afterwards or beforehand on any clubhouse, on any property, if you got a group that are gathered. If there's 2 people in a golf cart, they're obviously not 6 feet apart. If there are 3 or 4 people standing around on golf courses, they're not social distancing. So instead of getting into how is the flag in the hole and did someone touch the ball washer or those other things, let's focus on the same issues that everywhere in the country they're focused on, the CDC guidelines of social distancing. No large gatherings above 10, and stay 6 feet apart from each other. There's probably 30 or 40 recommendations on here. They're unenforceable simply because they're too specific to golf. I mean, the same rules should apply if someone's on a boat. If you have 12 people on a boat, if you've got 10 boats tied together, those are the rules that we're getting way too deep into the weeds trying to figure out what is good and bad on the golf courses. The bottom line is, the issue that's most important to me is eliminating any out-of-county residents from coming to play on our, I still call them, these are the lures. If we could firmly eliminate the ability for out-of-county residents to use any of our resources, our recreational resources in this case, they would stay in their own counties as long as we offer enticements and opportunities for them to come up, or the ability to come up because we don't know how to regulate them out. And that's more my concern. The folks that are represented here today are what I consider private clubs. You cannot get on their property, okay? But there are some other facilities that don't have the benefit of security guards at a gate and a sort of secured neighborhood. How do we give instruction and advice to those folks? You know, I was talking to some of the operators. They said that they look for driver's licenses when they are taking tea times, and they can do some residency requirements at that time. It's a self-policing kind of issue. The other thing that we need to take into consideration, at least I have one example, where the homeowners association, completely separate from the golf operation, has requested that the golf operation not exist or not continue to operate. Not that they shouldn't exist, that they shouldn't continue to operate. How do we figure that scenario out? This is a complicated process. If we're going to remain open, we need to create very easy, understandable, reasonable requirements that are enforceable. And then if people, because even this last weekend, there were a couple of clubs that I'm sure all of us heard from, that were not following the rules, that basically said, we don't care, we're not following those rules. Those people need to be shut down. I don't know if we punish every other facility because 2 or 3 or 4 said, well, we don't care. We're going to continue to have people come here from out of the county. Some of these are clubs that have affiliations with out-of-county other locations. That's what we can have. And if we can't figure that out, then of course we'd have to shut it all down. The governor should be handling this if I haven't mentioned that yet. Thank you, sir.
Okay, where does that leave us?
Are we going to come up with some ideas on residents only? I think we're splitting hairs with pencils, and so if we can't come up with craft something with residents only, then I think we're going to have to move to shut them all. So we have to come up with something that protects us, and I don't think that splitting hairs into the suggestions, certainly I think we could distribute these, but I think we have to come up with something to limit the play.
If that's directed at me, I think I cannot guarantee you, because nothing is an absolute. I believe that the legal department can come up with a way, in conjunction with the sheriff's department, if what you want to shut the golf courses down to is Martin County residents only, then we would come up with a set of criteria of what constituted a resident. A driver's license or a Florida ID is the easiest way. I know in individual conversations with folks, there's folks who consider themselves to be residents, but they may have an out-of-state driver's license. So I suppose that they could show something like a copy of their deed. They could probably show where they own something, not maybe the deed, but they could show where they're a property owner. They could show, I'm thinking right now of how people show residency to enroll their children in school, a copy of a deed or lease, a electrical bill, a power bill. There are ways to do it. Now, again, we're getting down in the weeds, so perhaps the hope in doing this and providing a certain number of ways of how you provide residency, the hope would be that would send a clear message, and the folks in the hot spots would stay put, if that was going to be a requirement. Obviously, the asking to provide proof of Martin County residency really isn't a big deal to those club owners, clubs, because those folks are offering the golf course amenities just to people who live in that area or live off the golf course. So I think the closing it to Martin County residents really only speaks to clubs that are open to the public or allow some public, or those clubs that have both private memberships, and then they also offer off-premises memberships. And then in those cases, if they've got a member that lives down south, they can't play.
But with that said, looking at Selfish Point here, I'm sure that he's got some of his members that are here that own a house but aren't Martin County residents. They're residents of Connecticut and only
yes,
have a
sir.
Connecticut driver's license. So,
But they would own property. They would be owners. If I heard Mr. Ewing properly, it was only going to be the occupants and the residents in Sailfish. In the example of Sailfish, it's someone who's physically on the property. No guests.
so it's very important that we actually define the term resident, because it doesn't necessarily mean you're a resident registered to vote, or you could be.
Yeah, we would, thinking off the top of my head, a definition of a resident would be someone who is actually physically residing in a home located within the boundaries of Martin County.
There you go.
could do it that way.
Mr. Chair.
Yes, sir.
Two things. One, I just want to remind the folks that are watching this at home that the commissioners are not allowed by law to speak to each other outside of these meetings. We are under the Sunshine Law. A lot of people that are following what we're doing probably for the first time, because this is a very serious issue. We are not allowed to speak to each other as elected officials outside of this meeting. So if it looks like we're up here just brainstorming and listening to different suggestions, trying to come up with ideas with our staff, that's because this is the first time we've had an opportunity to be together to do that. Our staff also does not have the ability to tell us what each of us are thinking. That's telegraphing. So it's not like when you hear from our attorney and it seems like this has turned into a frustrating conversation. It's because she is now hearing from the five of us collectively at the same time. We each have a different set of experiences that make this either more obvious for some than others. If this was a conversation on landscaping or other issues, I'm sure Commissioner Jenkins would be leading the charge on this. So the other thing I think is important, Mr. Chair, is that if we cannot figure out a strategy here and we leave here with a convoluted situation, I think we would have to then revert back to maybe a more stringent and restrictive requirement of our golf courses. If you are a and I don't say this easily, but if you are a semi-public course with the ability to have others come into to play on your facility, and then now we're forcing you to try to figure out what are residency requirements. There's no easy answer. It's not like we haven't figured it out yet. There is no easy answer. Someone can own a home in Palm City but have an Ohio driver's license. They're not going to be able to bring their ownership documentation, because remember, these conversations are going to be had at the security guard house in the front of these communities. And now you've asked the guard to start handling back and forth documents, and then they would have to basically be security lawyers to understand what documentation they're looking at, which would be acceptable for proving that they are residents of our county. Meanwhile, there's 25 cars behind them. I think we might have to reluctantly get to the point where we narrow this opportunity more. I had come in this morning thinking that the private clubs, the clubs that are the residents, some of the folks that are here, and there's dozens of them, that have the ability to know who their residents are because they live within the confines of their neighborhoods. And they have the ability to regulate what those folks are doing because they're neighbors and the residents. We might have to go to an approach that is the private clubs and let them regulate themselves. The governor pushed these decisions down onto us. We would have to push them down. A lot of these HOAs are they run the golf courses themselves. Versus, like the example I used, I have an HOA that does not want their course that wraps around their neighborhood to be open. It's a corporate club, and so how do we address that? And I think This brainstorming session should have been an untelevised workshop, but we're not allowed to do that. Thank you.
There you left us hanging. Commissioner Smith.
So under what I heard a little bit ago, I think the direction we should give our staff is to work with the sheriff and to establish a policy or a format that establishes residency that is workable, doable. We can't define that here today, but you all will, and issue that emergency order to all the golf courses. And however the sheriff deems fit to enforce it, and how the golf courses choose to, their management chooses to do that. Most, if not all, the courses I've talked to, their booking system is enough to understand who's on the course and who's not on the course. I mean, there's a way to probably, from their perspective, from the management side, Michelle told us she knows every single person that's on the course. You know, so it shouldn't be difficult to understand who's there and who's a resident, who's not a resident. But we'll leave it up to the staff to establish what format is a resident. I mean, for homestead purposes, there's requirements that you have to produce X amount of documents to provide what your homestead is to become a resident. So I'm sure there's a simpler form to get there that we could do, that we could give guidance to our golf courses to operate under, that it wouldn't be, as you say, as complicated at the guard gate, because you can't have that. You can't have 4 forms of ID going to a guard gate and saying, look, I'm a resident, I swear to God I am. You know, that's just not going to work. But something more simple than that the actual golf course management structure side of this thing can regulate from their end of it. That's just
Get
a
a lot
recommendation.
of head nodding, so it'd be great if what you just said was in a
You want that in a motion?
motion.
Mary Kay, did you get all that in the motion? So at least I would offer up a motion that would reflect what I just said, that we direct staff to work with the Sheriff's Department and our legal department to establish residency.
Mr. Range, just go ahead.
Okay, I appreciate it. Thank you. And I apologize, I appreciate the opportunity to make a clarification point. A lot of these clubs, I think what we need to do is, the public golf courses can be limited to Martin County residents. A lot of the clubs have members, and I think the club should be limited to members, whether they're residents or not. I just want to be clear on that, because ironically, a lot of the clubs are the ones that don't have residences around them, are probably some of the safer ones too, because they're out in the more open spaces. But we do have members who aren't residents but are members of the club. So if we could limit the private clubs to members, then I think that would work.
Well, not only that, is some of the clubs in my district are literally on the county line.
Right.
And some of their membership is actually across the line.
Yeah, so I appreciate that.
Existing members.
Existing members, correct.
Existing members needs to be included.
Yeah. So I appreciate
residents.
the opportunity to make that clarification. Thank you.
So Bob, sorry.
Yes, sir.
Mr. Chair, is it all right?
Yes, please.
Yes.
So would you agree that if the motion were to state residents and members?
Existing.
Yes.
Existing members?
Existing members of clubs, I think would work for us, yes.
Absolutely.
What about clubs that don't have members?
You got to be a resident.
You have to be a resident. If you don't, because the
Which I
member
appreciate,
clubs.
but we're back then to the same issue that we were having. I get it. It's easier for certain clubs that are member-only clubs. You already know who your members are.
Correct.
That's obvious, and they're very secured locations. But in Palm City, I have 5 that are not member-only clubs. What do I tell them?
They're
What
residents.
level and I get it, and that's why it was much easier to do the private. But with the public ones, and the ones that have the homes right up on the fairways and the other, locations on the golf course, how do we protect our residents from those? And then if, for instance, there's a club that says, well, I appreciate that, but I'm not going to follow that, how do we shut them down? How do we then go in and completely shut them down?
Can I
We've
suggest
already
that?
talked about that the sheriff has full authority to do that.
Shut them down?
Yes.
Just say it's over?
Yes.
And then how does that not come back to us then to finalize that decision?
Ed?
That's
Or
the
Mr.
sheriff being the law enforcement and the judicial portion then. Okay? Just want to be
Commissioner
clear.
I think to Ed's his last comments, how do you deal with the public-private courses? The only ones that would be allowed to play would be members and/or Martin County residents.
So that's where we were at the beginning.
No, not really. No, because what you said, what you want the ability to do is only have Martin County players. In those instances, you're going to have two opportunities to be a player. You'll have a resident opportunity player, and/or if you have a membership in that course, you'll have the ability to play. If you're a non-membered golf course, the only people that would be able to play there would be Martin County residents.
Just a point of clarification.
She's
When we
working.
say members.
Can't hear you.
I'm sorry, as a point of clarification, just so when we say members of a private course, that means members, not members and guests.
Correct.
Members.
Yes.
And existing members. You can't
Existing
join the
members.
club
Sorry,
tomorrow.
Existing members.
Right.
Yeah.
So that would be my motion, Mary Kay, that it would be members and residents, that we direct staff to formulate a requirement and order.
Existing
members.
What? Existing members.
Existing.
Got it.
Are you happy, Mary Kay?
Yes.
Okay.
And it still includes the part about working with the sheriff to establish that.
Yes, ma'am.
Yes. Yep.
Because he'll be the enforcer, not us.
Mr. Chair, I didn't hear a second.
Yeah, I didn't either.
I have a suggestion before we go to make it easier for the semi-private clubs to verify residency. When you contact the club to book a tee time, you should then be required to submit via email your proof of residency so that that can be verified prior to you arriving at the club. That way, there's a little bit of lead time instead of people standing around waiting to go. When you book a tee time, you'd have to then have the ability to prove your residency. Just as I think it's important that as we craft these policies, we give the people that are responsible for executing them some understanding of how we would expect this to work. We can't just say, here's a new policy, not sure exactly how it works, best of luck. That's just fraught with problems.
Is that a addition to the motion you're asking for, or?
I'm very uncomfortable with the direction that this is going, and I would need to hear the motion again.
So, Mr. Chair, just to clarify that issue.
Okay.
All of us go to gated communities for various functions and events. Every event or every function that we go to, there's always a list at the gatehouse. When you go through the gatehouse, you give them your license, and if you're not on the list, they call somebody to find out if you're supposed to be there or not supposed to be there. I think what Ed is suggesting is just that the golf courses can figure out a way with their management and with their guardhouses to have that list produced at the guardhouse. So
I
that
think
when
they do
people-
that already.
I'm sorry?
I believe they do that already. I
Well,
can't speak for everyone. If you
they-
roll into just so to clarify, please, if you roll up to a country club, a private course, and a private neighborhood, you can't just say, I'm here to play golf. You'd have to say, this is my name, I'm here to play golf. They take out a list of the tee times, and they look to see if your name's on it. So I do agree with what you're saying.
And you can be
and
a
I think-
guest.
But we'd have to
Yeah,
make it no guests.
And I,
I'm sorry. Go ahead.
Commissioner Hetherington.
If you're a resident of a course, a members-only course, then you don't need to produce anything at the gate. You have access to go in and out of a community. So I don't even know why we're talking
Well,
about
no,
who
we're
has
not talk-
access. If you live in a community, you have a little badge, you go into, I think this is getting way too detailed. We're either going to make a decision, or we're going to have to go and
We're not-
close the
we're not
courses.
talking about
They're either going to
private.
self-regulate, or we're going to close the golf courses.
Talking about privately owned golf courses that have outside resident members.
But if you don't have a badge, don't live in that community, then that self-regulates right there. If you're a guest, you're saying golf courses have members that don't live within the gates?
yes.
Don't you have some kind of, how do you get in the gate every time you go to play golf? Do you have a membership card that allows you to get in the gate?
Yes, we're hearing that's correct.
Okay, so you're already validated that you're either a member, and anybody else shouldn't be allowed in, period. public courses shouldn't have any non-residents.
That's what we're
That's the motion.
talking about. We weren't talking about private golf courses. We're talking about,
So do you want me to restate it all? Or?
please.
I'll try. So Mary Kay, the motion was to direct staff to work with the sheriff to create a order under the Emergency Powers Act that we operate under to create a system or a rule, if you will, for members, Martin County residents, and no guests on either side of that equation, in coordination with the Sheriff's Department. And I think to Stacy's point, I think to Ed's point, I think the only the only issue to that will be the public gated courses, but that will all be resident driven, however they create a policy that will work to identify who a resident is and a non-resident. All the other private courses will be self-regulating because they won't let anybody in anyway unless you're either a resident, owner, or a member of that course. And apparently, shaking of heads, they all seem to have some sort of an ID process or something that they do that already. I know I don't get to get into Sailfish unless EJ personally comes out and walks me through the gate, so I know how that works. But
Commissioner, are you making that existing members?
Existing members.
Existing members.
yes, ma'am. As of today.
Ms. Woods.
I just, not to the motion, I want to assure the commissioners that Mr. Stokas and I and the rest of the administration would do our best to try to also put out guidance documents, kind of like a frequently asked questions, to try to help folks understand what they need to do to help.
Okay. We have a motion. Mr. Campier, you have any additions to that you would like to feel comfortable with? No? Okay. Commissioner Heather?
I can't do it alone.
No, you can't. I don't have a gavel to pass, or I would, but
Pass that
virtual gavel has been passed. Commissioner Heather, I will second the motion.
There's a motion on the floor by Commissioner Smith and a second by Commissioner Jenkins. All those in favor, say aye.
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 Those
Opposed, say nay.
Opposed?
Opposed.
The motion carries 3-2 with Commissioner Hurd and Commissioner Campy dissenting.
Mr. Chair, the only reason I'm opposing the motion is not because I disagree with what Commissioner Smith was trying to put forward and the three of you agreed to. I just personally feel that we're putting too much on the staff. There's too many variables here. I like the content, but I think to put it out and just, there was so many things that were left unsaid, I think it's putting a difficult process on the staff. I would be comfortable seeing some of this formulated back together, but we're also, I appreciate what you've done, and it was a difficult decision, and I appreciate what you've done. I'm fearful that it's just going to lead to potential problems, but I'm hopeful that it won't.
Well, I'm hopeful that by next meeting, you'll actually be able to see the document and be comfortable with what is produced. Okay, Mr. George, do you have anything to add, or?
I just want to confirm the effect, when is the effective date? Today?
Today. Tomorrow.
Whatever's practical. Today, tomorrow.
Okay.
Okay. Mr. Abate, I understand you have some things you would like to talk to us about.
Good morning, Kevin Abate, Parks Director for Martin County. This past week when you all talked about the closings, I had put together a short list of things that were not discussed, and I think that would be appropriate to look at those items that weren't discussed and see what direction you would like to head. So I have a list here. I'd like to pass it along. I think you have this spreadsheet.
I have one.
While you're getting that list, the parks have been busier than ever. I'll attest to that personally. I know at Halpatioke Park, we were very busy last weekend, and I think the trend will continue.
Get to it, Kevin.
Yeah.
No. Please.
Thanks. I got one.
Yeah. Okay. So if you look at the list on the left column, there are all the things that are currently closed: beaches, sandbars. That's not the county, but county golf course, the water park, and the list goes down. And then these are the things on the right column that you have not considered yet, such as disc golf, futsal course, which is a form of soccer, racquetball, skate parks, so on and so forth. So there are a number of other things that have not been considered. So I thought maybe a better way to consolidate what you see here on this list is to maybe express it in a real simple form. I think the goal of the commission was to have more of a passive recreation, such as walking or biking or hiking or those types of things. So I came up with a real simple paragraph, which really just says that the use of county park trails, pathways, boardwalks, fishing piers, and open areas are permitted. And then all programs, amenities, facilities, and athletic complexes are closed, including the use of water fountains, grills, and trash cans. So that's a way to summarize this entire list. I put this list together for my contact with the sheriff's office so they can understand what was open and closed after Tuesday's decision. So it's probably the easiest way for me to express it is that you really want to have folks enjoy the parks and go outside, obviously with the recommended CDC social distancing and group size recommendations. And I think the best way to express it is in a short narrative form, and then the list will just solve itself by that narrative.
Go ahead, Commissioner.
The one thing that strikes me really quickly that I'm not in agreement with the closure of the bathrooms either is the trash cans. We went through this a few years back where we decided to remove trash cans for a while, and that was a huge mess. And it's not as if there's not still public in and about our spaces. So I know it seems kind of a silly issue to start off with, but I would maintain our trash collection and trash.
It was just on there due to the interaction between what the public is actually touching and using, going in the cans, and our county employees that constantly have to empty them and take care of them.
Yeah, it's just one of those things that whether, I'm hopeful that we don't close down our trails. Hopefully we don't close down our biking, because I think those are different activities relative to people being out in space, not dissimilar to this conversation we just had with golf. I think that's a different activity than a sporting activity that is a collective group of people that are in a closely confined area that causes people to be much more in touch with each other. The other, I'm fine if you want to have a more collective policy, statement. I'm more fine with that than instead of listing every single individual item.
Okay. I have a question.
Yes, ma'am.
Mr. Abate, tell me why racquetball courts, skate parks, roller hockey rink, and volleyball are not closed, because those seem to me to be kind of competitive sport venues also.
I think they were kind of put there for a discussion, so it was unclear to us on if that was actually the intent of the board direction.
Seems like that's a pretty good invitation to congregate to me.
No, we forgot to mention, that's why he's here, is because he wants to close them. Yeah.
Okay.
Yeah.
Well, I think that those probably are the same, fall into the same category as the tennis courts, basketball courts, those things.
Would you reread that sentence that you're,
Use of county park trails, pathways, boardwalks, fishing piers, and open areas are permitted for use. And then all programs, amenities, facilities, and athletic complexes are closed, including the use of water fountains.
are you comfortable with that, Commissioner Hurd?
I think so.
Yes.
And I'm with you. Don't take away the trash cans.
Yep. Okay.
I had a question.
Yes, ma'am.
On, what do you consider primitive camping? So the tent, is that tent camping?
Yeah, so I actually wanted to talk about, right now, the campground at Phipps Park Camping is open for RV and individual tent camping. It's not currently too busy. We have about 20 folks using the campground now. And those restrooms are open for those users. So that is kind of separate from this. But primitive camping is bring your own tent, basically. So, and that was outside of that paragraph. This is the only other area, the public campground, which is currently not terribly busy, and I think it's dropping off after next week, after Easter.
So we should not be taking on any additional new...
Yeah, I would recommend that we don't take on any new reservations and let those folks that are there run their time out. There's a limit stay anyway on how long you could stay at, for instance, for a tent camping, you can only stay 14 days. So let them kind of run out their time, and then and it will solve itself by May anyway. But I would exclude the campground from that narrative.
Okay.
I'll move the language that Kevin has given us with the various edits.
Second.
With a question.
Yes, sir.
Mr. Abate, on the equestrian arena out at Timer Powers Park, out in Timer Powers Park, folks can't just roll up there with a horse and a trailer and use it. There's some kind of a...
There are public hours for that, so they can do that.
I would like that to be residents only.
Yeah, that would be under a facility, so if you want to exclude it at Timer Powers, that's not a problem.
Well, I'm looking at the list. I mean, if someone's at a fishing pier or, sitting on a park bench, I get that. But that specific issue of the equestrian ring where people could trailer up horses from out of county potentially because their facilities are also closed, I just think that's the one on the list that I think we would have the ability to regulate because they know who's coming in. You can't just pull the gate open and go into the arena, correct? Or can you?
It's not a locked gate, so it is kind of open ride. And we have a staff person out there at Timer Powers. I know the park is very busy now, especially on the weekends. So it's not monitored on the weekends, so
Okay.
it is kind of open.
It's not the end of the world. I just figured if we could make that specifically because, trailering horses up from out of county would be a thing. Thank you. Otherwise, my second obviously still stands.
I just realized that you said fishing piers because I skimmed this and missed it. You're proposing to close?
No, actually, it's use of county trails, pathways, boardwalks, and fishing piers in open areas is permitted.
I missed it in two places then. Okay, I'm sorry.
Where are you seeing this language? Is it on?
He's just reading.
No, I'm just reading up something I wrote that you would consider.
It's a wonderful job you did, too. Okay, I lost track. Didn't we have a motion, and did we have a second? All in favor? Sorry.
No, it'll be another comment after that.
Okay, that sounded unanimous to me, was it not?
Yes.
Okay, Mary Kay? It was kind of odd, but it was unanimous, yeah.
And then just to that comment, because the horse question, I saw an email or a Facebook post somewhere last week. Dupuy management area is not under our jurisdiction, correct?
No.
It's a state-run facility. So the comment was that we were allowing anybody and everybody to go to Dupuy and do what they wanted to do out there, and that's not our facility to manage.
Yeah.
Just so people understood that.
You good?
I'm good, thank you.
Yes, sir.
Okay. Okay, now we're to our commissioner comment portion of the program. Commissioner Smith.
Two things. While Denny was here this morning, I made a quick comment, and again, I to the Hudson family and to the Seacoast family, our condolences for the loss of Corky. As well, I would wish that you would all, in your prayers, the person that I'm going to talk about should remain nameless only because I don't know that it's public of her illness, but we have a very dear friend who's been incredibly supportive of all of us in Tallahassee, who is gravely ill. And if you just all could keep that individual in your mind and prayers, that would be most helpful. But she has been a real stalwart supporter of all of ours in our county, and it's very sad what's happening. Thank you.
Commissioner Heatherton.
I just simply wanted to say a thank you. Thank you to our medical professionals who are every day on the front line, and you see things change rapidly. They change here rapidly, and they are doing an amazing job. Our first responders, our school district, our teachers, everybody that has had to adapt to this, it's just, it really amazes me every day what a strong community we have. And I think that's why we all live and love Martin County, because of the people that make all this possible. Our staff has been working night and day. I appreciate that. And my thoughts and prayers go out to the family member of our first victim of COVID-19. So hope that we would keep him in our prayers, or her. And again, I think our first responders, our medical community is doing such an amazing job, and wanted to echo what Rob Lord said this morning. Now is the time to double down and continue our social distancing, or as one of our speakers said this morning, social responsibility, and keep Martin County safe and healthy.
Completely agree. Commissioner Campy?
I'm fine, thank you.
Commissioner Hurt?
Just a reminder to residents that we now have daily updates on the COVID-19 pandemic on MCTV at 4:30. Thank you. And our next meeting is next Friday, correct?
April 17th and the 24th for our special COVID meetings, and then our upcoming regular meetings, April 21st. And with that, we're adjourned. Thank you.